Good morning, John.
Good morning. I forgot my suit, so I'm going to disappear for a minute.
You're good to go, Mr. Chairman.
Thank you. Well, we'll call this meeting to order, and can I get roll call right off the bat?
Senator Ellis,
Present.
Senator Hutchings,
Here.
Senator Landon,
Here.
Senator Rothfuss,
Here.
Representative Brown,
Here.
Representative Connolly,
Here.
Representative Flitner,
Here.
Representative Freeman,
Here,
Representative Obermuller,
Here.
Representative Paxton,
Here.
Representative Peeperinen,
Excused for now.
Representative Simpson,
Here.
Co-Chairman Coe,
Excused.
and Co-Chairman Northrop.
Here.
We have a quorum.
Thank you, Josh. All right, I'm going to lay some ground rules down. When we have public comment, we're going to, unless you've spoken, if you have spoken before, then those people that have spoken, like some of the CRC people, we're going to limit them to 3 minutes each. And the people that have not spoken, such as Superintendent Balo and some others that would like to speak, we'll let them have the floor for at least a reasonable length of time. I'd like to get this meeting done by 10:30, and so would not want to drag it out for the entire morning. With that, we're going to go into the agenda, and the agenda starts out with Lachelle Brandt and Becca Steinhoff doing an overview of the last meeting that they had. There's Lachelle.
Good morning, Mr. Chairman and
Good
members of the committee. My name's Lachelle Brandt, Senior Policy Advisor for Education in the Office of Governor Gordon. And as the chairman said, I'm joined by several individuals that were instrumental in the work of the Early Childhood Governance Task Force. Senator Cost, Becca Steinhoff, Director of Wyoming Kids First, and Elliot Regenstein with Foresight Law, who helped facilitate the work of the task force. He has a lot of experience also working in other states with early childhood governance. So all of them will be available at the conclusion of my presentation to answer any of your questions that you might have regarding the process or the final recommendations of the task force. Thank you again for this opportunity to briefly present to you the final recommendations, and we once again ask for your support in the proposed statutory changes. As a reminder, the task force started its work by identifying a set of core principles for designing an agency structure for Wyoming, including valuing coherence, high-level leadership, policy clarity, better information for parents, and the capacity needed to actually deliver quality. The task force then discussed the core functions of the early childhood system and agreed that a fragmented system like we have today is not what's best for providers, children, or families. After in-depth discussion about the pros and cons of different possibilities, on October 23rd, the task force made a set of recommendations about how the state might reconfigure its system to be more efficient and more effective. Its recommendations focused on consolidating functions into two agencies, the Department of Education and the Department of Workforce Services. I'm sorry, the Department of Family Services, not Workforce Services. The Department of Family Services would absorb the Quality Counts program from the Department of Workforce Services because DFS is already the lead agency on child care, and it makes sense to combine those responsibilities. DFS would also be given a leadership role in organizing home visiting programs in the state. Some of those programs would continue to be executed by other agencies, including the Department of Health. But there was agreement that our home visiting work is not well organized and that there's no clear leader to develop a plan for getting it organized. The task force's recommendation is to vest that leadership at DFS, which was clarified and reaffirmed at our final meeting on December 4th. The task force recommendation on October 23rd was to consolidate special education functions into the Department of Education, including both Part B services for 3 to 5-year-olds and Part C services for 0 to 3-year-olds. Those responsibilities would be moved from the Department of Health. The Head Start Collaboration Office would also move from the Department of Workforce Services to the Department of Education. The Head Start community's desire is to have the Collaboration Office located in the same agency as IDEA, and the task force has supported that approach. Between October 23rd and December 4th, the task force received feedback from multiple stakeholders, and the primary issue on which feedback was received addressed the move of special education functions to the WDE. That issue came up at the last committee meeting, and the task force also received numerous letters on the subject. At the December 4th meeting, the task force heard a presentation from the WDE about why it believed Part B special education in particular should be moved to WDE, and we also heard from the CDCs about why they believed it should not be. After the presentations and some subsequent discussion, which I'll discuss more in a moment, the task force was polled again, and once again overwhelmingly voted to continue recommending that Part B services be moved to WDE. After that, there was a brief discussion about Part C, and there was wide agreement, including from the CDCs, that Part C should be in the same agency as Part B. So the task force then reaffirmed that recommendation as well. So there are a few things that are important to understand about the task force's recommendations. One is that it is based on the fact that Wyoming is the only state in the country where Part B services are not delivered by the state education agency. Federal law requires that the state education agency be responsible for Part B services, and it has been. But WDE's conclusion is that the arrangement of subcontracting does not work well, even though the Department of Health has tried very hard to make it work. WDE talked about multiple compliance issues that have come up through federal oversight and expressed its belief that only bringing responsibility into WDE would allow the state to maintain the program in compliance with federal requirements. Another important thing to emphasize is that the state already has regulatory power over the CDCs and school districts when it comes to IDEA. The state currently exercises that power through both the Department of Education and the Department of Health. If the task force's recommendations are implemented, it would not give the state any new power over the CDCs or school districts. It would just mean that the power the state has would be exercised solely through the Department of Education. In addition, the task force made specific recommendations about how WDE should be allowed to exercise its power. The task force calls on the Department of Education to engage with the CDCs, school districts, and families to set up its process for awarding IDEA funds. The task force also calls on WDE to ensure that if it plans to change its approach to funding in any community, that it must engage that community to discuss the proposed changes. The task force report specifically says, quote, communities potentially impacted by changes in WDE's approach or by any proposed shift in service delivery should have the opportunity to weigh in before any final decisions are reached. WDE also reported that if it assumes oversight that will not require CDCs to contract with multiple school districts, which was a concern raised earlier in the process. In fact, CDCs would be able to continue maintaining a single contract. The task force's job was to recommend a framework for addressing the needs of communities across Wyoming. The CDCs have raised numerous concerns about the possibility that in some communities, responsibilities might be taken from the CDCs and given to school districts, which they say would be bad for children and more expensive for the state. The task force's recommendations aren't about what is the best way to deliver service in any community. The task force's recommendations are how the state can do the best job of managing limited resources and making sure that every community has the best possible service. By consolidating Part B services into one agency, the way every other state does, the task force's recommendation will help the state do a better job of serving communities. And again, the task force's recommendations wouldn't give the state any new power over the CDCs. If anything, it gives the CDCs more voice by recommending specifically that when WDE is exercising its authority, that it must engage communities while doing so. That's not specified in current law. So if anything, the task force's goal is to see that the CDCs have more procedural protection while working with the agency that federal law designates as responsible for Part B funds. In closing, the task force's report represents the thoughtful consideration of a broad group of stakeholders, including all 4 impacted state agencies and community representatives from around the state. Our state government needs to be more responsive to families and communities, and that's why we convened the task force in the first place. And the task force's recommendations represent a meaningful agreement about the best way forward. The state has been working, as you know, on this problem for years, and this is the furthest we've ever actually gotten towards solving the problem. In keeping with the task force's recommendation, the governor's office is committed to engaging stakeholders throughout any transition process to make sure we're remaining focused on what's most important, improving outcomes for children and families. Thank you for your consideration, Mr. Chairman, and we'll stand for questions.
Thank you, Lachelle. Becca, do you have anything you'd like to add?
Thank you, Mr. Chair. Lachelle did a great job giving an overview of the task force's work. And so in an effort to get through this meeting in a timely way, I do not have anything further to add, but as she said, I would echo that I am available for questions as well.
Excellent, thank you. Senator Cost, do you have anything?
I will echo what Becca said. As far as any more, Lachelle has done a great job of explaining the whole path that we followed and everything that we've done. I'm here to answer any questions somebody may have if they want a particular question, but there's no need for me to spend time that you have, precious as it is.
Thank you, sir. So does anybody on the committee have anything you'd like to ask of the people that are presented? Raise your hand.
Mr. Chairman.
There you go, Representative Connolly, go ahead.
Thank you, Mr. Chairman, and thank you, Lachelle, for the report. We left our last meeting with the understanding that there was some concern or pushback from some of the local CDCs, which I'm sure we're going to hear about. We're getting the emails, but that you also had this final task force meeting and that there would be a kind of formal vote that happened at that meeting. Can you tell us a little bit about what happened at that meeting and the process for that final vote?
Sure, Mr. Chairman, Representative
Ahead,
so at the last task force meeting, as I mentioned, both the Department of Education and the CDCs presented kind of their arguments, and then the task force heard those, and then a straw poll was taken, and as I said, the majority for Part B moving to the Department of Education, the task force voted for that change, and then it was unanimous that Part C would be with Part B, and so they reaffirmed again our recommendation from that first report to you that it should go to the Department of Education.
Great, thank you. I just wanted to kind of make sure that you went through the process that you talked to us about at the last meeting, and the result was the kind of the same bill that we had then, that we have now. Thank you.
Thank you. Any other questions from committee? Questions from committee?
Rep. Pete Baranin has one, Mr. Chairman.
All right, couldn't see his hand. Go ahead, Representative Pete Baranin. And nice to have you join us this morning.
You're muted.
Thank you. Go ahead, Representative Pete Baranin, and nice to see you this morning.
Gary, you're still muted. There we go.
Sorry.
There you go.
During this task force meeting, when there was discussion about engaging the local districts in discussions, was it ever speculated what type of issues would arise that would encourage that dialogue to happen? What would bring about that engagement?
Lachelle, would you like to answer that?
Mr. Chairman, actually, I might ask Becca Steinhoff to answer that, as she's worked with that community, might be able to share some insight on that.
Go ahead,
Sure.
Becca.
Mr. Chair, Representative Piperinen, we didn't discuss any issues that might arise that would lead to some of those changes, but left it quite broad so that there would be direction for that engagement to occur. So our hope, I guess, is twofold. One, we recognize the value of school districts and CDCs working with families and others across their community to support children who have disabilities or developmental delays. And so in building a system, we know that there needs to be a continuum of services and supports that goes from CDCs into the school districts. And so we anticipate that there will be a strong connection in that way for programs to work together. We did not have conversations directly with school districts during this process. We did have representation from a school district, but it is, we don't know, without hearing from all school districts, I'm not sure that we are fully prepared to talk about what issues might come, excuse me, from their lens. So the task force just noted that it would be important for there to be a platform for collaboration and continued conversation among those entities without identifying those issues in advance. Does that answer your question?
Thank you.
Further questions? Further questions?
Mr. Chairman, you've got Rep. Freeman and Senator Landon.
Thank you, because I'm up here in the northern part of the state and our internet connections are terrible up here. We're lucky to even carry a Zoom meeting. So thank you. I appreciate that. Go ahead, Senator Landon.
Mr. Chairman, thank you. Lachelle, this is probably for you, but it might also, I'd love to hear from Senator Koss, Representative Brown. We have talked about the efficiency and effectiveness of what we're up to with this proposal. I wonder if you could expound a little bit on the conversations that the task force had with regard to this efficiency piece. Is it more from the side of just the governance structure itself, or are we going to realize any budgetary sorts of efficiencies? Given the climate that we're in, I've been asked that. And so anything you can provide to me on that front would be helpful.
Mr. Chairman,
Go ahead.
Senator Landon. Well, I think there's a few different ways to look at this, but number one, I think, the earlier children are identified will ultimately reduce the cost of special education in the state if those children receive services earlier, which we understand is an issue at the current time. Secondly, as far as the fragmented system with these programs sitting in 4 different agencies, I think in the last committee meeting, I was asked what all the funding sources were for all of these programs. And at that time, I'm not even sure that we actually knew where all of these funds sat. So I think there is a lot of efficiency to be found. I think some of the money that we do receive federally is returned because we aren't as efficient as we can be. So I do think over time that putting these under one umbrella certainly will lead to efficiencies and better outcomes ultimately for children.
Thank you, Mr. Chairman, for that. And Lachelle, thank you.
Go ahead, John Freeman, Representative Freeman, would you like to ask your question?
Yeah, and I don't know if you can answer this or not, but I appreciated the idea that you looked at it from a coordinated governance, a consolidation, and a creation of a new department. You chose on consolidation. Is the ultimate goal is to create one agency that deals with pre-K? Thank you, Mr.
Go
Chairman.
ahead, LaShalle.
Mr. Chairman, Representative Freeman, I think ultimately, if you had all of these programs sitting like many states do in one location, it probably would be the ideal situation. But as we know, it's taken a lot of momentum and time to get as far as we have. So I would say, you know, as you move into the future, after some of these programs are under two umbrellas, potentially looking at the cost savings and better services for families and children, I think ultimately probably would be the best option. But I think this is, considering the complexities of having it in 4 agencies, probably the best we can do under those circumstances.
Very good. Thank you. Senator Hutchins, we have a question.
Thank you, Chairman Northrup. I do. I have a couple. My first one is, can someone tell me the cost to the state currently versus adding these to the Department of Education? What will the cost be? Then I'm hearing the schools are already overburdened right now. How will this change affect them if made? Thank you, Mr. Chairman.
LaShalle, would you like to clarify that?
Sure, Mr. Chairman, Senator Hutchins. I don't believe that there's any additional costs. The Department of Education is already responsible for Part B and Part C. So we're essentially just moving staff over to their agency. So we're not looking at additional costs, and we're not looking for school districts to take over any of these programs. Essentially, we're looking at trying to put them in one location to better provide leadership, as I spoke about in the beginning, which was something the task force really felt like we were lacking in the state, so that there is leadership, that we ensure that we're meeting the federal requirements for IDEA and that there's that oversight. But we're ultimately not asking school districts, and at this time, under budgetary restrictions, I would have a hard time believing that many of them could take on new responsibilities.
Thank you.
Thank you. Any other questions?
Mr. Chairman.
Go ahead. Representative Simpson.
Thank you, Mr. Chairman, and thank you for holding this extra meeting for us. It was part just to give you an opportunity to conduct one more meeting before you left. Thank you for your efforts of being our chairman this last few years. Mr. Chairman, I have a question for Mr. Regenstein. Elliot, we appreciate you coming and being with us today. I think we're all supportive of consolidating this effort, but some of us are conflicted between whether the mother agency should be the Department of Family Services or whether it should be the Department of Education. Would you share with us your experience? I understand you're multi-state experienced. What are the other states doing with this program?
So thank you.
Go ahead, Elliot.
Yeah, thank you so much. So honestly, different states have done this differently, and states have also switched over time. So for example, North Carolina was one of the first states to consolidate its functions into the education agency, and then some years later moved it into the Health and Human Services Agency. Arkansas went the other way. They had it in the Human Services Agency and moved it into the Education Agency. To me, from having talked to people in states around the country, the most important thing is not which agency it's in, it's does the early childhood community feel like it's in the agency that's responsive to their needs, right? So that's what was so important about the task force process, was it was a chance for key stakeholders to express their view. And, you know, I think it's really important to emphasize that while other states have done it well in various different configurations, that none of those models would make perfect sense here. So the perceived advantage of having functions in the education agency is that it sort of connects more naturally to schools. The perceived advantages of having functions in a human services agency is that it can connect more naturally to some of the community level providers. I think at this point, the task force's feeling was we still need both of those kinds of expertise in play, and that's why it came to the point it did. But I would definitely say there's nothing in my experience from any other state that would suggest that what the task force did isn't going to work, right? That there are different benefits and costs to different approaches, and this is where the task force settled, and I think that that's a testament to the process.
Thank you, Mr. Chairman.
Very good. Thank you. Thanks, Elliot. Nice to hear from you. Anybody else? Representative Brown, is that you asking for a question?
No question, Mr. Chairman. Just if there's any other questions, we can let them go. But one thing that I definitely want to make clear is, these are not half-hour, 45-minute meetings either. The last meeting that we had on December 4th was a little over 3.5 hours. We heard and gave public opinion, public input to the members of the task force. I mean, this was a very thorough and thought out process. Kudos to Elliot for herding the cats through this entire process, because the conversation that happened on December 4th was very well thought out. It was very methodically placed out there to make sure that everybody got their voice heard. And when Lachelle brought forward the vote that came forward, if I remember right, I think there was only one vote or maybe two out of both of the polls that came down that said that they did not believe that this was the best out of the entire task force. So again, this is also not we were very conflicted and we had a 51-49 split. This was a very overwhelming majority. And I do think that it's important for the committee to understand that the task force, this was not a fly-by-night task force. This was not something that was done quickly and behind closed doors. This was a very open and transparent process. And I commend Becca, Lachelle, and Elliot and Senator Cost for doing all of the meetings. Again, I did not attend to all of them, but I will say that I know that the information that came out of them was very well thought out. And I do believe that this task force, along with I think 6 or 7 other studies and or task forces that have studied to do this exact same thing, have all come out and said, this is the way that it needs to be done. So, Mr. Chairman, I think that this is exactly what I think not only this task force, but like I said, the other task forces and even our own management audit committee has recommended this movement multiple times. So I want to make sure that they are commended for all their hard work and know that the public needs to know that this was not done quickly.
Very good. Thank you, Representative Brown. Any other questions from the committee? Senator Hutchins, I see you. Go ahead.
Thank you, Mr. Chairman. 2 more questions have come to mind while we speak. And the first one is, right now, the students that are being, or the children that are being given these services, how are they progressing now? Are the parents feeling that they're not receiving the services they want or need? And then number 2, those service providers of these services in the community, the small businesses, how will they be affected by this change? Thank you.
Thank you, Senator Hutchins. Anybody volunteering to take on that question? Lachelle, go ahead, please.
Mr. Chairman, Senator Hutchins, I'll take part of it, and then I'll probably ask Becca to weigh in on part of it. But part of the discussion at our last task force meeting did revolve around the Department of Education sharing some of the concerns and data. And so, for example, there were over 1,700 children in the last 3 years that were first identified as a student with disability in kindergarten. And so while we know that in some communities, children are being served early on and very well, there are places in the state where unfortunately that isn't happening. So we need to do better. As far as the task force and the grant that we received, part of it was to do a needs assessment that did involve all stakeholders, including parents. And Becca, do you want to share a little bit of the feedback we received in the needs assessment?
Go ahead, Becca.
Yes, thank you, Mr. Chair, Senator Hutchins. We did do a needs assessment where we looked at both quantitative and qualitative data. That included a survey of parents. We had more than 500 parents respond to that survey who have children under the age of 8 in the state of Wyoming. And generally, the parents who responded whose children were receiving services were quite happy with those services. And we also hear that echoed from the CDCs who talk about their connection with parents. So that is consistent across all fronts. Where we had some concerns was parents who maybe didn't know where to receive services. And so we learned that our biggest gap at that point was making sure that parents understood where to go to receive services, or if they had a concern about their child's growth and development. And so I think we have some work to do in that child find space. And that's across that system where we would think about the other service and support providers who exist within communities and might be serving families and can help connect them to that pipeline or refer them to their child development center for that screening, so that parents can identify if indeed their child is able to receive services. So we received feedback. Those are the two most noteworthy that I would add. And I would say too that the task force did not specifically engage with families in this process. And so we had talked about that as an action item that we need to carry out in 2021 as we think about a transition plan to make sure that we're hearing from all stakeholders. So we had a parent representative on the task force, but we know that that one voice is not necessarily representative of all of the families who have children under the age of 8 or under the age of 5 in the state. And so we recognize that we have some more groundwork to do as we think about this transition and the best way to enrich the experiences of families who are raising children in the state of Wyoming.
Very good. Senator Hutchins, has that answered your question?
It answered the first one. Thank you, Mr. Chairman. But the second one, I wanted to know the small business providers of these services around our state, how will they be affected by this merger?
Becca, you want to take that off?
Sure. Thank you, Mr. Chair, Senator Hutchins. There are a couple of lenses that we want to look through to get to this question. So if you're speaking specifically about the child development centers that serve children with disabilities and developmental delays, to my knowledge, many or most or perhaps all of them, I would say, are nonprofit organizations that serve in their communities. And so they leverage a variety of funding sources to carry out that work. They do not stand to be affected as written. The task force, as Lachelle stated in our introduction, really hopes that those nonprofits will continue to carry out that work just under the governance structure of the Department of Education rather than the Department of Health. So contractually, their work would look different, though in implementation, it should not change and the funding to them should not change. There are also small business owners and perhaps more small business owners that stand to be affected that are childcare focused, childcare and early learning programs around the state. There are about 600 licensed childcare programs around the state of Wyoming. The significant majority of those are small businesses, and they stand to be affected through this governance structure, hopefully in a way that simply improves their world. Currently, they access services and supports across many of those state agencies. So childcare licensing is carried out in the Department of Family Services. That work is done in a different division than the childcare assistance and subsidy program that's housed at DFS, although again, in a different division. Those two programs stand to be more closely connected through this change. The Y Quality Counts program provides critical support for professional learning and higher education for those licensed early childhood professionals. That program will move from the Department of Workforce Services to the Department of Family Services, which will again consolidate childcare licensing, childcare assistance for families, and then professional learning supports for early childhood programs all into one space. So we're really hopeful that the movement of those programs will support them in getting to some of the efficiencies that we talked about, not just efficiencies at the state level, but also creating efficiencies for programs and small businesses who need to access state services and supports.
Good job. Thank you. Okay, Representative Flintner, you had I'm sorry, Chairman Flintner, you had a question.
Thank you, Mr. Chairman. I appreciate it. Ms. Brandt, you had stated that there were 1,700 children with disabilities that were identified in kindergarten. Of those that were identified, how many of those had received early intervention care?
Go ahead, Lachelle.
Mr. Chairman, Representative Flintner, I don't believe any of them. That would be something that I'd have to follow up with the Department of Education from their data. But my understanding was they were first identified when they entered kindergarten. So they had not received services.
Thank you, Mr. Chairman.
Thank you. Further questions? Further questions from the committee? Go ahead, Representative Freeman.
And maybe I missed this, but I think that one of in my experience in the past is that there needs to be a gatekeeper. I remember our school, when I worked at the alternative school, was looking for child services for our students that had children, and we didn't have one place to go to figure out what services were available. With this consolidation, is there going to be a gatekeeper, or at least just two gatekeepers instead of a half a dozen, which was my experience a long time ago?
Lachelle, would you like to answer that?
Mr. Chairman, Representative Freeman, yes, I believe that is the goal, to have that leadership, that one location. As Becca suggested, the disjointed nature of having it in 4 agencies makes it very difficult, but I do believe 2 gatekeepers will certainly be better than 4, and will definitely assist families in better providing and also consolidating it into one division, as it is sitting in multiple divisions within agencies as well, which is disjointed as well. So that is the ultimate goal, is to make that very easy for families to access.
Thank you. Thank you. Representative Summer, I'm sorry. Go ahead, Albert.
Chairman, thank you. And first of all, I want to thank the good chairman for all of his service to Wyoming for these many years, and for being a good friend of mine. And I sure do appreciate that and appreciate the work he's done. So that's my first thing. My second thing is just a question to get kind of caught up on this. I thought I heard Elliot say that different states do this differently and have it all in one agency, but it's apparent that and then I also have heard testimony that Part B, I believe, has to be in Department of Ed. Is that a requirement? Does that happen in every state in the nation? So how does there seem to be 2 different, I thought I heard 2 different things. So if I could get a little explanation about that, I'd appreciate it. Thank you.
The floor is yours, Elliot.
Thank you. And thank you, Representative Summers. So first of all, yes, federal law requires the state education agency to be responsible for Part B services. And so what that means is that in every other state, Part B services have been in the State Department of Education, and Wyoming has been the only state that has subcontracted that to another agency. Part of what the distinction goes to, and I'm glad you asked this question, is that when other states talk about early childhood governance, what they include varies a little bit from state to state. So for example, Alabama created a standalone agency just focused on early childhood, but it's really mostly focused on their preschool and doesn't have responsibility for childcare. You know, in some states, preschool and childcare have been really the major focus of their discussion. In other states, home visiting is a part of it. So not every state has included Part B in the conversation the way Wyoming has. And that's part of why you have some examples from other states where they've consolidated a number of programs together, but that if it's not in the education agency, Part B isn't necessarily a part of that. I will say that that's one of the reasons, you know, one of the arguments that's made in the states that have consolidated into education agencies, part of it is that they do want to have that stronger coordination with special education. So again, this is part of why, you know, part of the challenge in what's been sort of a murky field nationally where everybody's doing it a little bit differently. You're perceptive to pick up on that. In Wyoming, where Part B has been such an important issue, that was, I think, more central to the conversation than it's been in some other states. And that I think that's part of why the final plan from the task force reflects that prioritization of special education services. Does that answer your question?
Yes, it does. Thank you.
Thank you, Albert. Good. Senator Hutchins, go ahead. You're muted, Senator Hutchins.
Sorry about that. Thank you, Mr. Chairman. This question is to Lachelle. I just want to clarify that I heard her correctly when she answered Representative Flitner's question. She said of the 1,700 students that were identified over the last 3 years with having disabilities, how many received services? I do believe I heard Lachelle said none. Can she clarify that for me, please?
Yes, I'm sure she can. Go ahead, Lachelle.
Mr. Chairman, Senator Hutchins, again, I would say I would want to confirm that with the Department of Education and their data. But my understanding from that meeting was they were first being identified when they entered kindergarten and had not received services. But again, that's something I would have to get back to you or have them speak to today, maybe after we're finished.
Thank you.
Great.
Mr. Chair, if I could add to that really quickly.
Certainly. Go ahead, Becca.
Thank you, Mr. Chair, Senator Hutchins. I just want to add that there are children who have been identified and been served in early intervention programs, and that number does not include those children. So as I understand it too, those were numbers presented by the Department of Education. In the handout that you received, there is the number of children who were served by Part B services in that 3 to 5 age range. So there were several, there were thousands of children around the state who did receive services from CDCs that were identified. I think the number that is being referenced was from the Department of Education for children who had not been identified in that early intervention period. So again, more clarification is needed, but I wanted to provide that insight as well. Thank you.
Thank you, Becca. Chairman Paxton had a question. Go ahead.
I think there's some confusion on the words that we're using right now. I think what Representative Flitner, and she can correct me if I'm wrong, but what I think she was asking is how many of these children were receiving care by some kind of a program that were not identified. In other words, were they in some kind of a care program and not identified? I think that's what she was trying to ask.
Yeah, I got it. Okay, go ahead, Lachelle. Or Becca.
Mr. Chairman, Representative Paxton, I'm not sure. I would have to ask, again, the Department of Education for that piece of the data of what programs those children were involved in or not.
And I'll just add to that, Mr. Chair, Representative Paxton, and Representative Flitner. We, the part of our conversation in this governance space is to talk about data. We don't keep a record of which children in the state of Wyoming are in care in which programs. And so we know the children who are served with IEPs or individualized education plans or IFSPs if they're in that earlier time frame. So the children who are served in our CDCs for early intervention have we have data on those children. If we're talking about children broadly who are in early care and education programs around the state, we don't know which children are being served in that way. So we actually don't even know the true number of children who are being served in those programs. We know that about 68% of children under the age of 5 have all parents in the workforce. And so they're attending a program that is likely out of their home and somewhere else, but we aren't clear on exactly where children spend their days. And so we have really great data and understanding of the environments and the interactions that some children receive. And then there's a lot we don't know about where some children are and how they're being served.
Okay, anybody else? I'd like to hear from Superintendent Balow. Karen, is she in the waiting room?
Yes, she is, and she is joined by a couple of her staff. I'll go ahead and bring them in now.
That'd be great. Thank you. Good morning, Superintendent Balow. How are you doing this morning? You're muted. You're good now.
All right. Mr. Chairman, thank you so much for inviting me today. I'm sorry it took me just a couple of minutes to get set up. I think I'm still working on it a little bit. Can you give me a thumbs up, Mr. Chairman, if you can hear me okay?
You're
All right,
good.
thank you. Well, thank you so much for the opportunity to speak today. And first, I'd just like to share a little bit about my personal experience and my professional expertise in early childhood and early learning. I want the committee to know that as a parent, I, along with probably many of you, relied on a Wyoming CDC to provide significant interventions to my 3-year-old daughter, who was both physically and emotionally delayed. Our luck was that we lived near one of Wyoming's high quality and high performing CDCs with professionals who were very dedicated to intense and ongoing interventions. And that's likely what allowed my daughter to thrive and continue thriving without any break in service from preschool to kindergarten. I'm forever grateful to the CDC for this, and I hope that all children across Wyoming have the same experience with their CDC. But unfortunately, the reason that we're here today is because there are years of analyses that don't suggest, or that suggest that every child is not receiving that same high quality services or set of services. Our 14 CDC regions across the state have variability in performance, and that really needs to be addressed. And a governance structure is a really important place to address that. Help for our youngest learners, like my daughter years ago, should not be about luck, period. Professionally, I also want this committee to know, while I've had the opportunity and fortune of being the state superintendent for the last 6 years, I spent years of my career focused on early childhood care and education. In my former capacity at the Wyoming Department of Education, I worked with LSO way back when to provide information for a scoping paper about early intervention and programming. When I served as a policy advisor to former Governor Mead, I continued work on the issue. And prior to becoming the state superintendent, I was the administrator for early childhood or early care at the Department of Family Services. I oversaw childcare and high quality preschools across the state. Also, I started my teaching career as a kindergarten teacher. So since becoming the state superintendent 6 years ago, my stance on this issue in particular, early education governance, has remained the same, and it's been informed and methodical and consistent. And many of you on this committee have heard my stance, and it is to follow the recommendations of the task force as they have just set before you to move parts B and C into the Wyoming Department of Education. What I personally and professionally guarantee is that our staff of professionals will work through the transition with the CDCs, and we will root the work in the Department of Education. So it's part of the way that we do business as a state. There will be stability, there will be reliability, and there will be predictability. And I offer that same recommendation, the consistent recommendation today. But I offer it to you with a little more sense of urgency than I have in the past, knowing that 2 more years have passed with actual children like my own who aren't as lucky to receive high quality interventions from high performing CDC across the state. 2 years ago, this committee considered legislation that's very comparable and similar to what you will contemplate today. And after my staff and I presented facts and information 2 years ago, a motion to consider the draft bill was made, but there wasn't a second. So it was because of that lack of apparent interest in the topic that I opted to stay out of the conversation this year, trusting that the consistent recommendations from the federal government, from the Wyoming Department of Health, the Wyoming Department of Education, to legislative management audits, and now a recommendation from a stakeholder task force would suffice as information and recommendation. And in fact, that's what has happened. And thank you again, Mr. Chairman, for having another meeting for all of us to weigh in one more time. This interim, my staff has presented essentially the same facts and information as we have in the past, including a timeline of events and the recommendations that lead to the legislation in front of you today. And this time there's also a recommendation from a state early childhood governance task force that has recommended the same twice. The time for more studies has passed. 15 years of analysis has brought us to today, and it's time to make a decision. Please understand that my comments today and all along have never been driven by anything other than providing the best services for all children in CDCs across the state. We have high-performing CDCs and we have low-performing CDCs in communities all across Wyoming. We have a mountain of information to guide you in your decision-making, and we have community and state leaders who support high-quality CDCs with funding and partnership and expertise. My hope is that nothing changes for the centers where all the children who attend are thriving, and that all of the other centers have the opportunity and technical assistance to become high-performing. The Wyoming Department of Education, the Wyoming Department of Health, and the Behavioral Services Division that carries out the work of CDCs have worked tirelessly to finesse the current governance arrangement. Chief Academic Officer Shelley Hamill, who is on the phone or who is on this call, started her career working with special education, and she worked in a CDC in Wyoming and has a bachelor's degree in early childhood special education. 2 of our own sons were also recipients of services at a CDC, and she leads the work at WDE. We also have our special education director, Margie Robertson, who's also on this Zoom, and she served as a teacher and a principal in high needs schools and saw firsthand the difference that early intervention before kindergarten can make. She emphasized early education as part of her bachelor's degree also, and she leads the team that oversees the implementation of IDEA, which is the Individuals with Disabilities in Education, or the Special Education Act. There are 3 key points that should remain front and center when we're discussing Parts B and Part C. First, Wyoming is the only state, and we heard this from well articulated from both Becca and Lachelle and Elliot and members of the committee. Wyoming is the only state that attempts to run Part B at the state level with another agency. In this case, it's the Department of Health, in addition to the State Department of Education, which has the federal charge to ultimately oversee it. Wyoming Department of Education and Wyoming Department of Health have done their best. Unfortunately, the current structure makes it so that neither has adequate authority or expertise to ensure quality and provide the necessary technical assistance to bring all CDCs into high performance areas. Both state and federal law place Part B responsibility for receipt and dissemination of funds, monitoring and compliance with the Department of Education. However, in Wyoming, the Behavioral Health Division inside of the Department of Health serves as a 49th school district and must monitor the CDCs in the state without the expertise or the support of the Department of Education special education team, except informally. So this may seem like a non-issue for a well-functioning CDC, but it's everything for a struggling CDC. As a result of the governance structure, the WDE requires compliance, and we have less of an opportunity to directly coach and assist CDCs, as is the case in other states. In essence, the compliance requirements are intact in state statute, but the assistance requirements are distant and ineffective with the disparate governance structure. Second, and as you've heard already this morning, the data reveal that children are experiencing the consequences of our disjointed system. Senator Hutchins, Representative Flintner, I hope that this helps answer your question. But what we know is that over the last 3 years, there were 1,700 children in Wyoming who were first identified with a disability in kindergarten. They should be identified earlier. Moreover, there's a wide variance as to the type and number of services that students receive from CDC from region to region. There's substantial evidence of a staffing disparity among regions, and that is concerning the availability of service providers. This results in inequitable and inadequate support. And lastly, appropriate early interventions inevitably will reduce state expenditures long-term. Mr. Chairman, I'll close with this thought. If I were in your seat, and many of you have expressed this to you or to me over the past months, I would ask something like, well, if the expertise exists and it shouldn't matter which agency it's in, and the CDCs want to improve, it shouldn't matter which agency the authority or the expertise is in. So why not just do it? And we've sought the answer to that question over the course of the last 15 years, and then some. And the answer to this is that really the current statutory governance structure perpetuates issues that just can't be resolved unless the governance structure changes. And therefore, just consistent with the advice and the recommendations that I've given for a number of years, I concur with the task force, all 21 of them who voted to move Part C, and the 20 of 21 who voted to move Part B. I may have that backwards. I can't. I'm sorry if I do. I concur with the task force overwhelmingly that the governance structure and Parts B and C should be housed wholly within the Wyoming Department of Education. So thank you so much, Mr. Chairman and members of the committee, for your time and your consideration. And Margie and Shelley and I stand ready for questions that you might have.
Thank you, Superintendent Balow. Does anybody have a question for the superintendent? Go ahead, Representative Flintner.
Thank you, Mr. Chairman, and Superintendent Balow. Thank you, and thank you for all your efforts over the years for early childhood intervention programs and for the move for this effort with this task force. I appreciate it, and I appreciate the additional information as well. With regard to staffing, and if staffing is an issue today, and if equitable and adequate, I mean, those terms don't go, I recognize those terms and the fact that we use those with regard to K-12 education. How will you address staffing issues, especially in those areas where it's an issue today? How can that be remedied with this?
Go ahead, Superintendent Balow.
Mr. Chairman and Representative Flintner, those disparities are identified and corrected through the monitoring process. And I would love to turn it over to our Special Education Director, Margie Robertson, to just visit a little bit more about the process that we as an agency go through with K-12 and the assistance that we would expect to offer the CDCs in that respect.
Go ahead, Margie.
Thank you, Chairman. Representative Flitner. So the Wyoming Department of Education, Special Education Programs Division, we conduct regularly review of our data, and we have data share outs that happen across the state. And we dig into our data and look for inadequacies in the system in Wyoming, and then we address those. We conducted 7 data share outs across Wyoming this past year and included the CDCs in that process. When we identify a broad area need across the state, we are allowed to use some of our IDEA federal Part B dollars to address concerns with issues with staffing in particular. So that is actually something that's on our docket right now. Is something that we want to address, is finding ways to help school districts, and ultimately it could also affect CDCs at recruiting adequate staff. So there are state activity dollars under IDEA that the Department of Education has, and they absolutely could be directed towards needs that were to arise as we were to work with the CDCs. That is something that we can do. We also go into each individual school district and BHD as a whole school district. We're in the process of reviewing records right now for that, to look for inadequacies or things that need to be addressed within individual systems. I hope that answers the question. Thank you.
Mr. Chairman, follow up.
Thank you. Go ahead, follow up.
Thank you. And Ms. Robertson, I appreciate that. So then would the funds available be used to augment salaries, or would you have the funds available to actually implement salaries for positions that may not be in place today?
So, Chairman, Representative Flitner, sorry, this is my first time being on this call. Absolutely. Dollars can be used. Their federal IDEA dollars absolutely can be used towards augmenting salaries. Districts are already receive those dollars, as do CDCs. However, there is also a small portion of the federal dollars that we set aside as an agency that we could do a number of things. So typically, as an agency, when we decide how to spend our portion of the federal dollars, we pull together stakeholder groups. And that absolutely would be on the table. It could be the possibility of stipending or augmenting salaries. It could be a recruiting process. It could be a sort of grow your own program where we help build up people in Wyoming that want to become special education. So there's a whole lots of possibilities of the ways that we could spend those dollars. And we like to really pull together stakeholder groups as we design that. And that's what we're in the process of doing right now because of those data share outs. So, so the answer is yes, it is absolutely possible. And currently they have federal dollars that they are allowed to use as well to augment those salaries. Thank you.
Thank you. Thank you, Mr. Chairman.
Thank you. Any other questions? Senator Ellis, go ahead.
Thank you, Mr. Chairman. This question is for Superintendent Bailow, if we still have her. I don't know how to ask this delicately, so I apologize if it doesn't come out quite right, but there just seems to be a lot of distrust about the Department of Education taking the reins. And so I just was wondering kind of how we got there, and, you know, I just want to know, be curious to know what your thoughts are on how we can calm some of that distrust.
Superintendent Bailow, go ahead.
Thank you, Mr. Chairman. And unfortunately, I dropped off the Zoom call. Believe it or not, Mr. Chairman, you may not be the only one up in Northern Wyoming, but I think I got the gist of the question, Senator Ellis, and that is how can we allay or assuage some of the mistrust in this change. And what we know is that that changes is always frightening. There's the fear of the unknown, and the best way to quell that is transparency and continual input. If there's one thing that is tried and true and consistent in my administration as state superintendent, it is exactly that. We engage stakeholders. We have a public process. I'm not driven by anything related to authority and power, etc. And I believe that those with whom I work as colleagues or as peers understand that about me. We will approach this work the very same way. Mr. Chairman, Senator Ellis, and other members of the committee, as some of you have visited with me about the bill that's in front of you today and possible amendments or ways that we could do exactly what Senator Ellis is asking about. We've suggested things like timelines and within the bill, or some specific milestones stated in the bill, the engagement of stakeholders. And so while we would continue to be transparent and collaborative in the process, I think it's a great idea to also put some of those milestones or reporting requirements within this bill to help ensure that and make sure that it is brought forward to this committee and to others to see that work through. I might also just like to point out that Becca and Elliot and Lachelle and others either on this Zoom on camera or who are listening to it are key stakeholders, as are the CDCs. They've had input so far. There's no reason to believe that would go away. And everyone has a different perspective. So it's not necessarily the Department of Education kind of driving the boat from here. It's the Department of Education being part of the transition, the successful transition and rooting of this program and this process and this structure within the Department of Education. I hope that helps.
Senator Landon, go ahead.
Mr. Chairman, thank you. And Superintendent Belo, thank you so much for being here this morning. This is a related question, and it really goes to the heart of what I've heard from fellow legislators. For whatever reason, it's either a perception problem or a reality problem or whatever with regard to public education. I think sometimes there is this perception that it just continues to grow and grow. What would you say to those who say, well, here we go, growing our Department of Education? How are we going to quantify the efficiency, the effectiveness? That's a hurdle for some of us to go out in the chamber floor, and support. Here we're taking something away from a couple of agencies and we're taking it over to the Department of Education. What are your thoughts on that, Superintendent?
Superintendent Belo.
Thank you, Mr. Chairman. Senator Landon, certainly if my staff and I felt that we could do this without those FTEs, the shift in FTEs from the Behavioral Health Division to the Department of Education, I think we would try to take that on. The truth of the matter is that we do need that manpower and that institutional knowledge related to the programming as it is now. And we think that there would be efficiencies and efficiencies and greater leveraging of expertise if that was housed within one agency. As you've heard today, there are other entities as recently as the task force that agree with that assessment. So in terms of growing government, certainly this is not growing government. There are no additional FTEs that are added to government. It's simply adjusting the governance structure so that it better meets the needs of CDCs and children across the state. Also, just one other reminder, the Department of Education is still ultimately in charge of Part B. And so while we don't necessarily have the authority or those FTEs in our agency, by federal law, we're still responsible for the oversight of that. That has actually resulted in several visits from the Office of Special Education Programs, who have pointed out those inconsistencies and even recommended that change to us. So I guess to allay that, it would be simply that is a misperception. Government is not growing. The program is not growing. We're simply adjusting the governance structure to better meet the needs of CDCs and children and to better meet our requirement under federal law to oversee the program.
Mr. Chairman, thank you. And Superintendent, thank you for that.
Thank you. Anybody else? Question? Nope. All right. If not, we'll move on to public comment.
Thank you again, Mr. Chairman, members of the committee.
Thank you, Superintendent Balo. Okay, can we get comment going, Karen, on?
Yes, sir. I've just admitted 3 people into the room that are interested in providing public comment.
Thank you. All right, Marcia Riley, I see. Good morning. Why don't you start it off? Why don't you start us off, Marcia?
Okay, there we go. Thank you so much, Mr. Chairman. I'm wondering if I could ask that my colleague Alicia Roan give our introduction so that you can have a platform for what our overview is talking about. Alicia, are you ready for that?
Yes, Mr. Chairman.
Yes, go ahead. And remember, you guys have spoken before, so I'm gonna maybe combine your time to the 2 of you for like 6 minutes.
Okay, great. And we also, thank you, Mr. Chairman. I have on the phone with me Marcia Riley from Sheridan and Buffalo, Jamie Stein from Laramie, and Davey Huff from Jackson. And we'll cut our presentation really short then, and hopefully have enough time to go over some things. But I did want to answer a couple questions that have been brought up on the call, especially from Senator Hutchings, as far as the potential cost to the state. There could be a huge cost to the state with this systems change. And I mentioned that in the task force because the CDCs right now, we receive about $6,900 per child for Part C and $8,700 per child for Part B. Children under IDEA in the school districts for special education receive upwards of $18,000 per child. So there's a huge funding discrepancy between what the school districts receive for special education and what the CDCs receive. And when IDEA is 3 to 21 years old, I think our state needs to consider funding these children the same, especially because we increased or moved up that kindergarten start date to August 1, means that CDCs will be serving more 5 and 6-year-olds. And so there's that disparity in funding, which could ultimately be $23 million a year cost to the state if moving us under the Department of Education, because I think the question will be raised, why doesn't my 5-year-old who didn't make the cutoff date only get $8,700, but the children in the school district get upwards of $18,000? I think that cost needs to be addressed in this bill, and I would ask that the LSO look into that. There is always a cost to systems change. You can't just uproot and move over to one and think there's not going to be a cost. There is. And so I just wanted to address that, and that $23 million a year funding disparity will be brought up if moved to the Department of Education. Also, when we state that children have not been identified, or that 1,700 children were first identified with a disability from the past 3 years to once they entered kindergarten, we don't know that those children didn't get a development screening. Perhaps they did before the age of 2 and then between 3 and 5. And maybe due to our protocol, we didn't show a delay. So we have no idea if those children actually received a development screening. Also, we don't know where these children were housed. As Becca said, they could be in a home daycare environment. We can't go door to door asking parents if their child has a disability. The CDCs provide over 5,000 development screenings per year for children. So I feel like we do our best to screen as many children as possible. And it is hard to catch everyone unless you're going door to door. So I think you need to keep in mind that we have served over the past 3 years, 10,000 children ages 0 to 5. So because last year we didn't identify 400 children, which is less than the 2 years before, doesn't mean that we are not taking every effort to screen children with free development screenings. My center alone did 1,200 screenings last year. So I think we need to take that into account, that we are definitely doing our best to identify children with special needs and serve them. So again, I wanted to touch on costs. I think we have got to look at that with the situation that we're in as a state, in the budget crisis that we're in. We've got to consider costs, because down the road that could be brought up and could eventually lead to a lawsuit as disparity in funding. Also, I bring us back to the why. Why are we doing this now? CDC's received huge budget cuts from the Department of Health, and due to our account because of the pandemic. If we move to the Department of Education now, who hasn't received huge cuts in funding, does that mean we're going to take additional cuts in funding with this move right now for better efficiencies and cost savings? We haven't really identified those efficiencies or the cost savings. We do save the state millions of dollars each year by graduating children off of their IEP prior to entering kindergarten, millions of dollars. So the state doesn't have to spend that in special education. And I think it's important that if we have this move, it's delicate to have a plan. Department of Education, we enjoy working with the Department of Education. We do right now. We have for the past 30 years. This started in the Department of Health way before IDEA started, because of a partnership with the University of Wyoming and the Department of Health with the WISP program. Then IDEA came along. And so it was already established in the Department of Health. But I think they need to understand fully our programs. Like, what is going to happen with the early hearing and detection program? I have a doctor working in my center, an audiologist. With the sound booth, what's going to happen to early hearing detection? What's going to happen to our Medicaid billing, daycare services, everything that these programs are made up of? We haven't even begun to talk about. And that's what we've always asked for the past 3 years that I've been fighting this. Give us a plan. Let us create this plan and then do the move. But we don't have that. It's, well, we're going to move and we're going to figure out the cost and the plan and everything else after the move. That is bad business. And I've said that all along. So I do think we need to discuss costs. I do think that we need to address the conflict that has come about because of this task force, because of the strain that it's put on the Department of Health staff and the Department of Education staff. That's concerning. Yeah.
You're putting time?
3 minutes. Okay.
Okay. That's been 6. Thank you.
Oh, sorry. Okay.
So, Mr. Chairman, thank you for the time. I wanted to say, yes, I'm Marcia Riley, the Executive Director from Region 2, which is Sheridan and Johnson County. And as you know, our CDC provides special education services and therapy services inside private preschools in Sheridan, Ranchester, Story, Buffalo, Claremont, KC. And this is the portion of early childhood that I do hope gets to hear a little bit from the task force. I think the task force did good work that we never heard about, because we talk about early childhood, but we really seem to be talking about children with developmental delays. So we look a little bit like those private preschools, because in Sheridan, we do have a medium-sized preschool with 4 classrooms. And so we too answer to the Department of Family Services about licensing. And so we have created an environment that's somewhat different. In our preschool, 50% of the children are on IEPs and 50% of the children are typically developing. Different than other preschools, where it's more like 90% typically developing and 10% developmental delays. I wanted to speak to a corrective action plan. So when I took this job 5 years ago, the volunteer board that I worked for was very concerned because the agency had been put on a corrective action plan in January, February, and this was April. So I went to work trying to solve this. And this is the thing that the Department of Ed, the one that we just heard from, had put this agency on a corrective action plan. The problem stemmed from IEP goals, that they really were not measurable. I read the goals. I said, I certainly agree with the Department of Education. Things like, let me talk about a child, Priscilla. Priscilla can't walk, she scoots around on the floor. Her goal should have been something like, Priscilla will respond to the teacher's one-step instruction to choose to participate in the car center or the doctor center. So now this becomes a measurable goal. So I went to work right away because the board was concerned. I called the WDE, the Wyoming Department of Education. I called and I said, okay, where's my contact person? I need to get started on this. They told me we've had a staffing change. We can't really address that right now. So I said, when will we be addressing it? They said they would get back to me in a couple of weeks. So it really was the next January before this agency came off the corrective action plan that the WDE had enough staffing to talk to us about what the problem was and how to solve it. And in the meantime, of course, we're worried because we're writing goals that were not acceptable to the WDE. So these kinds of problems become a problem to us when we talk about the WDE. And I know that we've written in an amendment that says the WDE must engage communities. But the WDE seems to come in and muddy the waters with things like poor performance. And I will tell you that the staff that we have are special educators, and there is no poor performance.
Thank you, Marcia. Your time's up. Could I ask Matt Wilmarth to clarify a couple of things that were brought up? Matt, are you on?
I am, Mr. Chairman.
Thank you. Could you look into, can you tell me about 5 and 6 year olds? I thought 5 and 6 year olds were in K-12. So if that funding for those people should be coming out of the K-12, shouldn't it?
So yeah, Mr. Chairman, any student enrolled in the K-12 system identified with an IEP would be funded through the block grant formula, which special education is 100% reimbursed, but also school districts do receive federal IDEA funding for those students as well. So the funding we're talking about here, the Part B, I believe is focused on the 3 to 5 year olds that are within the CDCs throughout the state. And so you are correct that the 5 and 6 year olds that are enrolled in a K-12 school district would be addressed through the state and those federal funds that school districts receive. And I would offer the Department of Education to offer any clarification of that as well.
Department, would you like to clarify anything? Anybody? Thanks, Matt. All right. Who else would like to speak on public comment? Jamie, go ahead, please.
Thank you, Mr. Chairman, members of the committee. I want to say thank you for allowing me to interact with you today. And I'm going to avoid being a broken record here today. And I just want to address some of the concerns that have been raised here this morning by several legislators in different areas. One of the comments that I want to make is, and I might defer to either Becca or Elliot for the exact number on this, but as I recall at the last governance task force meeting, while there was 23 people present in that call, only 15 actually voted for that move. And so the rest of those all abstained. So I just want to make that clear that there was a significant portion of the committee that did not even actually vote in that final vote. But I will stand corrected if that is not correct. I just remember seeing the numbers at the bottom of the page. Also, I want to talk a little bit more about those 1,700 students that had not received services when they enrolled in kindergarten over the last 3 years. The Part C program was never assigned WISER IDs until after the management audit report was issued in 2018. So prior to that, there's no way to track whether some of those 1,700 children had received services under Part C, but then did not qualify under Part B, 3 to 5 year olds, because they were within age appropriate levels at that point. And by the time they got to kindergarten, might have had a few more delays that came about because they were not able to continue receiving services under state statutes with our eligibility requirements. So I just wanted to make sure that we pointed that out. It was also pointed that a lot of those kiddos might have been screened but didn't qualify for those same reasons. And also, how many of those kids actually moved to Wyoming right as they were registering for kindergarten and never had the opportunity to receive services in the state of Wyoming? The reports to the School Finance Recalibration Committee actually showed that preschool students that needed IDEA services were 14% receiving those, whereas K-12 it was 14.2%. So we're right in the realm. So to keep saying that we're not identifying children that should be, I think needs a little bit more study. The other thing is that CDCs for years have been told by legislators that we over-identify kids. The management audit report phase 1 issued in 2016, that was the primary purpose or the focus of that report was to determine whether we over-identified. So we've been told that we're over-identifying. Now we're being told we're under-identifying. And I think that's just because WDE is trying to show that there's a bigger problem than what there really is with children not receiving services. I just wanted to make sure that that was brought out today. My final point is that everybody keeps saying this is not growing government, but I will argue that it will grow government at some point. If Wyoming moves forward with a licensing system for preschool, which I hope that they do with quality initiatives, it will require Department of Education to establish a duplicate division to license those preschools. And that will be doing the exact same work that DFS already does to license childcare, which will in fact grow government and create more hoops for private providers to jump through to be able to be licensed in both arenas. Thank you. I'm happy to answer any questions that somebody might have.
Thank you. Anybody else have any public comment? All right. Anybody have a question for the ladies? None appearing. Any more public comment? One more time.
I would, please.
Okay, Mr. Davey Huff, please go
yes,
ahead.
Thank you. I'm sorry. Thank you for recognizing me. I'm Dave Huff. I'm Special Ed Director for Region 4. We serve Teton and Sublette counties, but I'm also the president of Child Developmental Services of Wyoming. And I'm just here to support Alicia, Marcia, and Jamie in their comments, and realize that there are 4 of us here, but we represent 10 of the 14 regions. And these 10 regions stand behind these comments that this is a bill that needs to be looked at before it is implemented. We don't feel that there is a laid out plan that we're comfortable with. And I do want to just totally reiterate what's been brought up many times. It's these 1,700 children. And behind 1,700 children are 1,700 stories. And we don't know those 1,700 stories. And so I hope you don't just listen to numbers and listen to the fact that we need more data before that number is passed around. And it is being used against us. And I think that is very concerning to me. And thank you once again for recognizing me, Mr. Chairman, and the committee.
Thank you, sir. Any questions for Davey?
Mr. Chairman.
Representative Brown, go ahead.
I guess I'll just ask a quick question that Mr. Hoff brought up, and then I think it would be actually more directed towards the Department of Education. But after 15 years of having this be brought up and 15 years of discussing this, my assumption would be that the Department of Education would have some sort of a plan. So I'm just kind of curious if we've talked about this, and it's been brought up multiple times, and it's been, defeated multiple times. And I feel like we're at a point now where we finally have a working group that has come together and talked about this. But if I could get some explanation from the Department of Education as to whether or not they actually have a plan and what that plan briefly entails, if they do have one.
Well, I'm sure they have a plan. Let's hear from the Department of Education. Is somebody available?
Mr. Chairman, if not, I might be able to answer his
Very
question.
good. Go ahead, Michelle.
Mr. Chairman, I think it would be probably inappropriate for the Department of Education to have a plan prior to the task force voting on these recommendations for these moves. Until December 4th, those moves had not been fully vetted by the task force. We've built into the bill time for transition to happen and for a solid plan to be built between agencies. That was the intent of that longer timeline than is normally the case. And just one other item I might mention as far as the topic of costs. This bill isn't about costs. And if there were one-time costs, those costs potentially can be covered by the extension grant that the state has applied for. So any cost during this 3-year window could be paid for by any federal funds. I don't believe that transitioning this to the Department of Education increases the costs, whether it sits in the Department of Health or in Education. That's the case. And so I think the true efficiency for this is getting these into one place so that we can look at all the federal funding streams and better utilize and leverage those resources. So thank you, Mr. Chairman and Representative Landon.
Thank you, Lachelle. Superintendent Balow, would you like to comment on this?
Yeah, Mr. Chairman, I thank you, Lachelle, for laying that out so well. It's well articulated, and I would just add that in essence, and consistent with what I said 2 years ago as well, there's the planning is pretty laid out in the legislation that you're contemplating. It's a move of 4 employees to health, from health to WDE. It's the same program that we're already doing. And so I think that it is also premature for the department to say, these are the hurdles, or these are the challenges, or these are the changes, and this is how you should deal with it, because that's part of the transition. And it's making sure that we talk to stakeholders throughout the process, namely CDCs, to ensure that the transition is smooth, collaborative, and transparent. I guess I just want to underscore again, the move is really moving the early intervention team from the Department of Health to the Department of Education, notify the Office of Special Education at the federal level of our changes, and pull stakeholders together to look for ways to improve outcomes for students, and be able to deliver our responsibility as the overseers of Part B better than we have with a disparate governance structure.
Good job. Thank you. Thank you, Superintendent Balow. RJ Cost, I'm sorry, Senator Cost, would you like to comment?
Thank you, Mr. Chairman. The one thing that I want to add is through recalibration work and everything else, the funding is for K through 12. And so the cost per student that we receive for students in our educational process is clearly delineated in the Picasoden and the court things as kindergarten through 12th grade education. So saying that would automatically force it into other areas is not true. That's not going to happen that way, because the funding is not considered for those areas. So at this point, I would say that funding is a total different stream. It's a total different conversation, and I don't see that being a part of this.
Thank you, Senator Cost.
Mr. Chairman, this is Chris.
Go ahead, Senator Rothfuss.
Thank you, Mr. Chairman. I had a question for Superintendent Balow, and it's specifically about the budget that was being discussed. There was some implication that this move and this legislation would lead to significant increases in budgetary requirements associated with the program, whether that's in the short term or the long term. Concepts of, I think the number $23 million was thrown out there. So I'd ask the superintendent specifically, would you expect any additional appropriation needs, either in this upcoming budget request or in any near-term or future budget requests associated with this change, other than the obvious shift in a few of the FTEs?
Superintendent Balow, go ahead.
Mr. Chairman, Senator Rothfuss, thank you for that question. And in short, no additional appropriations are anticipated, and we have no indication that this will increase costs for the state or for CDCs. And just to reiterate, Senator Koss laid it out perfectly. There are two separate funding systems. K-12 is a reimbursement for services delivered. CDCs get a flat amount regardless of what they deliver, or regardless of what services they deliver, and that would not change.
Thank you, Superintendent. Thank you, Mr. Chairman.
Yeah, thank you. Further questions? Go ahead, Senator Hutchins.
Thank you, Mr. Chairman. Can we allow Mrs. Roan to elaborate on her statements on the 23 million? Thank you.
Mrs. Roan, would you like to elaborate?
Thank you, Mr. Chairman. Well, my basis was that, we've talked so much about IDEA, and IDEA is 3 to 21 years of age for special education. So I was simply saying, why isn't the state funding children the same then for under IDEA? If it's truly 3 to 21 years old, then we only receive $8,700 per child, but yet school districts receive $18,000 per child under IDEA. How is that funding discrepancy okay with the state? I think being under the Department of Education, that question is valid and should be raised, if not from myself, from a parent whose child receives special education services. And again, we do serve 5 and 6 year olds with developmental delay. If parents aren't ready to send their kids to kindergarten, they hold them over in the CDCs. And so we do get those kiddos. And as I said, moving up the kindergarten start date to August 1st means we're going to have even more children, 5 and 6, in the CDC. So why wouldn't they receive the same amount of funding under IDEA? I don't care if it's 2 different funding streams. And we have to provide FAPE, which is free, appropriate public education. We don't get any payment for that, but yet we are required to provide it. Whereas school districts get funding per child for FAPE, we don't. And we don't get any funding for buildings, for transportation. That $8,700 has to cover PT, OT, speech, cognitive skill development, preschool services, building, transportation. And yet there's just this huge funding disparity. And so I bring up that question, if nothing's going to change with this move in funding, why are we doing it?
Mr. Chairman, I have a quick follow-up for that.
Sure, please do, Senator Rothfuss.
Thank you, Mr. Chairman. Ms. Roan, based on that testimony, it seems that what you're suggesting is that by not moving it from its current place of administration, we're capable as a state of providing or having lesser obligations for services than we would. So the suggestion is that by leaving things in their current place, we're able to provide lesser services to children. Is that what you're suggesting? And that if we were to move it, there might be some obligation for the state to provide greater level of services, and just based on the administrative location, we can get away with that? I mean, that doesn't actually make sense to me. So I'm curious for a very brief clarification of why we would be able to provide under IDEA and under any other federal obligation a lesser quality of service or level of service simply because we're administering it through DFS instead of through the Department of Education. It honestly makes no sense to me. So if you could clarify that in a few short words, that'd be great. Thank you.
Go ahead, Alicia. A few short words.
Thank you, Mr. Chairman. And thank you, Senator Rothfuss, for your question. I think being under the Department of Health and moving to Department of Education lends itself, with the funding under education, why children aren't being funded the same. Again, legislators ask me all the time, why aren't you getting the same amount of funding for children under special education as school districts? And I can't answer that, but being under the Department of Health, we've been restricted in our funding. Department of Education does have the funding. They haven't gotten cuts like the Department of Health and other departments. So I think that question can be raised. Can we now support children at the level that school districts do? We always do more for less. We can serve children with quality services. I sent you 2,000 comments from parents over the weekend of the services that their child are receiving and how they are proponents of CDCs. We are doing it for $8,700 per child. I feel like moving to the Department of Education and the funding that we give to the Department of Education lends itself to receive more funding for these programs and these children.
Thank you,
Mr.
Alicia.
Rowan. Thank you, Mr. Chairman. And my apologies for saying Department of Family Services. I meant Department of Health on that, clearly.
Go ahead, Representative Conley.
Thank you, Mr. Chairman, and I've been hesitating on jumping in here, but it seems to me in this room that you're actually at this point arguing against your own interests. That it seems that this is a bill that really is about kind of clarification of administration and about streamlining and making things easier for the CDCs. But now that you're making an argument regarding money, which is not part of this bill at all. But if you're really arguing for more money for the CDCs, you're making the argument that moving to the Department of Education might be the mechanism for it to happen. So it would seem to me that you should be arguing in favor of this because of that possibility. But the reality is that's not what this bill does, at least in my mind. And what this bill does is it moves early childhood education, and especially for children with disabilities, from 4 agencies in the state to 2, with 1 being now the overarching organizational scheme. That's what this bill does, which all of us have recognized for over a decade, something needs to happen. So I am really curious about the argument that you want things to stay as disparate as they are, but you think that if it moved to the WDE, you might be able to get more funding for your agencies. Those things just don't make sense to me. I'm
Alicia?
hoping for some clarification.
Yes, would you like to clarify that, Alicia?
Chairman, if I might for a moment, this is Marcia Riley. I do think that part of this problem comes, and legislators, please forgive this, but I think part of this problem comes from the fact that the WDE has had plenty of time to talk to the BHD, Department of Health, and has not about these issues. And so our concern is that it won't happen again. And so when you say that, Representative Conley, that, this is only just about a move, we're unsure. We're very unsure that that's what this is about.
Thank you, Marcia. Representative Clinton.
Mr. Chairman, thank you. And I guess my concern and my question to the individuals we've just heard from who represent the CDCs was the discussion that you all are presenting to us right now. Did you have this discussion throughout the entire meeting process with the task force? And if so, why wasn't this hashed out before we're hearing it today?
Go ahead, Alicia.
Thank you, Mr. Chairman and Representative Flitner. We did bring up some of our concerns, with the task force. I feel as though that task force was, they don't understand the entire background of the CDCs and everything that the CDCs entail, as they shouldn't. I mean, they're not in the trenches. The only stakeholder that we had on there representing the 3,100 children that we serve was Jamie Stein. And so, yes, she brought up many of these. I actually brought up cost to a systems change in the task force meeting. I was told that was a red herring statement, that we shouldn't be bringing up cost. I feel like there is a cost to any systems change, regardless of what you do, whether it be now or 5 years down the road. But yes, some of these issues were addressed and were brought up. And frankly, I felt like they were looked over by the task force.
Does that answer your question, Flitner? I'm sorry, Representative Flitner, go ahead.
Chairman, thank you. And Ms. Roan, I appreciate that. And I think there are a couple of amendments that will be offered that may be that may help you in with regard to your reticence to change, and I understand that. And I would just hope that you would all keep an open mind. We all recognize and understand the importance of the CDCs. I have one in Basin near me, and I know of its importance, and I know the instructors who are there. So I just want you to know we hear you, but I hope that you will in time get on board with this, because I think with regard to the legislation, it does represent, I would think, a help to what you do there, your work there, and then ultimately the K-12 system as well.
Thank you, Representative Chairman Flintner. We'll move to Superintendent Balow. Go ahead.
Thank you, Mr. Chairman. And I would just appreciate the opportunity to clarify. I'm concerned that some of the members of the public are speaking on behalf of the Department of Health and the Department of Education with respect to cuts and services and intentions and communication. And there would probably be a lot of things to clear up and clarify with respect to that, but I don't know that they're germane to this discussion, except that so far this collaboration has been full of stakeholder input, as you heard Becca and Lachelle and Elliot and even members of the CDCs attest to, and that will continue. Mr. Chairman, our department does fiscal analyses and notes for legislative purposes on a regular basis, and we do not anticipate an additional appropriation to make this move. It is simply a governance structure move to better accommodate the CDCs and allow the struggling CDCs in the state to provide the best services possible to students all across Wyoming. And certainly, this is not an attempt to say CDCs aren't doing their job, or BHD or WDE. Everyone's doing their level best within the current arrangement. With a few statutory changes, we could be more consistent with the expertise and the professional services that we share, and we can leverage efficiencies better across the state. Thank you, Mr. Chairman.
Thank you, Superintendent Balow. With that, I'd like to close the public comment period and move to the bill. So the bill was tabled last, so I'd like to make a motion to take the bill off the table. Can I get a second? Second from Representative Freeman. Okay. By a show of hands, all those in favor say aye. Appears to be unanimous. I don't see anybody missing. Okay. So now the bill is off the table. Need a motion to work the bill.
Mr. Chairman, I don't think you actually need a motion to work the bill. Now that you've pulled it from the table, the bill is in consideration.
Okay, we'll take that. Okay, bill's in consideration. Senator Landon.
Mr. Chairman, with respect to the representative, I do think that we need a motion to consider the bill, do we not? Or do we go back to the meeting in November, and is that bill currently under consideration just by taking it off the table?
Mr. Chairman, this is Senator Rothfuss.
Go ahead, Senator Rothfuss.
Mr. Chairman, it was my understanding that we had a motion at our previous meeting, and if that is accurate, as I understand it, then it was tabled under motion, and when we bring it back from the table, it would be in its previous state, which would again be under motion by whomever the movant and second were at that time.
Right. Mr. Chairman, that's correct.
That would be correct, is right.
I agree, Mr. Chairman. Thanks for that clarification.
Very good. Okay, so Josh, would you like to run us through the bill? Just to refresh our minds.
Sure thing, Mr. Chairman. Josh Anderson, LSO. This is 21 LSO 270, working draft 0.5. This is the same version of the bill that was before you at your November 17th meeting. Just run very quickly through the bill. It's also very similar to a bill you had maybe 2 years ago. I don't know if that was a committee bill or an individual bill. I can't remember. But anyway, very similar to that previous effort as well. So the first section of the bill is non-codified language. Starts on page 2, Mr. Chairman. On July 1st, 2022, functions within Department of Health and Department of Workforce Services related to early childhood education programs will be transferred to Department of Education and Department of Family Services. The early childhood education programs transferred to the Department of Education will include educational services for children with developmental disabilities administered by the Department of Health, including IDEA Part C and Part B, and any Department of Workforce Service programs that coordinate the work of early childhood education programs. Programs being transferred to Department of Family Services will include the Wyoming Quality Counts administered by the Department of Workforce Services and home visiting programs within the Public Health Division administered by the Department of Health. And all positions, personnel, property, and equipment transferred to Department of Education or the Department of Family Services will be under the control of those departments. Over to page 3, subsection B, that on July 1, 2022, the governor will transfer to the Department of Education and the Department of Family Services all of those referenced positions, personnel, and property necessary to implement the provisions of this act. It also asks the 4 departments to work collaboratively to develop recommendations to the governor regarding what positions, personnel, property, and equipment should be transferred. Subsection C, again on page 3, again requires the 4 departments to work collaboratively to develop budget requests for the 23-24 biennial budget requests for those departments related to the transfer of those positions, personnel, property, and equipment. Subsection D requires the 4 departments to report back to this committee every 3 months on any necessary statutory amendments, rule or procedural amendments, or other regulatory amendments that would be necessary to implement the transfer of these programs, and any other issues that they happen to identify related to this transfer. Subsection E requires this committee to consider those reports along with early education stakeholder input and develop legislation appropriate for consideration during the 2022 budget session. And then finally, subsection F just specifies that the rules that are in place are not affected by this act through June 30 of 2022. Mr. Chairman, over to page 5 in section 2. These are statutory changes primarily to implement these changes. We'll see at the end that these do not go into effect until that July 1 date. Pretty straightforward. Page 5 and 6, Mr. Chairman. Over to page 7, adds a new paragraph to the duties of the state superintendent for being the state authority for early childhood education programs. Requires a superintendent to administer those programs overseen by the state. Requires the superintendent to administer early childhood education funding programs and coordinate those programs. Requires a superintendent to facilitate attainment of the goals of the state's public school system through effective implementation of the early childhood education programs. And subparagraph D, to provide a comprehensive network of programs and facilities to educate preschool children. Subparagraph E on page 8 establish minimum standards and policies and procedures for these programs and facilities to educate preschool children. Subparagraph F, create a division or section within the department to assist in the administration of this paragraph. And subsection G, contract with community boards, public agencies, and private agencies to purchase those developmental preschool services funded by the legislature. Bottom of page 8 in the definitions clarifies the definition of division to be the division within the Department of Education or Department of Family Services. Over to page 9, again, just another conforming change. Now that this division will be within the Department of Education. And same thing, Mr. Chairman, on page 10, section 3 on page 10 is a repeal of another provision that is now obsolete because the division will be located within the Department of Education. And then section 4 is the effective date. And as you'll note, sections 2 and 3, the statutory changes are not effective until July 1 of 2022. Take any questions, Mr. Chairman?
Go ahead, Senator Hutchins.
Thank you, Mr. Chairman. Josh, I don't know if I have the same bill you have, but every time we came to the word shall, you said will, and you changed it to to. I don't know if that was Freudian or if I have a different bill, but I have shalls all throughout my bill, but I heard will and to. Can you clarify if I have the same bill?
I'm sure, I don't recall, Mr. Chairman, Senator Hutchins, but I'm sure that it says shall. That's our standard drafting language, and that I just said will in my explanation.
Okay, thank you.
Further questions for Josh? Okay, thank you, Josh. All right, we'll work the bill. Anybody got anything on page 1? Page 2. Page 3. Senator Landon. Senator Landon, the floor is yours.
Mr. Chairman, thank you. I apologize. Working a couple of screens here, and I hope that committee members have had an opportunity to go to our meeting site and to call up the proposed amendments. I believe we have 2 that at least were posted there. Mine, I think, begins on page 3, and so, Mr. Chairman, it would not be a page by page thing, but this is sort of a collective 4-point amendment that I would move at this point. And if I get a second, I'll be glad to explain what the amendment does.
It's been seconded by Representative Brown. Please go ahead. Would you
Yeah.
like to have LSO share those amendments on the screen so everybody can see them?
We could certainly do that. I believe, Mr. Chairman, as I mentioned, everyone does have access through the meeting site. Thanks to Josh and Matt, those have been posted. So it's at your discretion, Mr. Chairman.
Matt or Karen, can you guys share those onto the screen? So
You bet, Mr. Chairman. Just give us a minute to get those on the screen for you.
thank you.
Mr. Chairman, in the interest of expediency, I'd be happy to just describe the amendment a little bit as we get technically ready to throw it on the screen. You know, ever since November, fellow committee members, I've just had a little sense of unease with this bill. And it's not because I don't believe in really what's being proposed. And you might remember that Senator Rothfuss and I actually drafted a bill 3 years ago to do many of the same things that we're considering here. So it's not that I have a concern over maybe doing what we can to improve the governance of our early childhood programs. It's just that this one came at us in quite a hurry in November. Many of us, honestly, were a little bit outside the circle. So ever since that moment, I was trying to zero in on some places where I had a little bit of heartburn. And that's what this amendment does, fellow committee members. It just simply does the following four things. It pushes the date back a little bit. It's an important enough endeavor that it just felt like to me that we need to take ample time to make sure that this is done correctly. I actually suggest that we require a working group that specifically drills into the CDC issue that we've spent a lot of time on this morning. I also asked for reports back to the Joint Education Committee. I think it's very important that our Education Committee is involved over the next year and a half with this process. To this point, our committee has not been that involved. And finally, this amendment will give some assurance to the developmental preschools out across the state with respect to their funding. The way this amendment is set up, Mr. Chairman, is such that we could certainly consider amendments to the amendment. We went ahead with one amendment which touches on all four of those issues that I just outlined. So, Mr. Chairman, if there's not any interjection on your part, I'd be happy to kind of go through each of these as they come up on the amendment.
Senator Landon, I think that'd be a great idea. So let's just do that. You said we started back on page 3.
We actually begin on page 2, Mr. Chairman. You can see on your screen that that we would delete July 1st of 22 and just simply insert January 1st of 23. That gives that little extra time that I just alluded to, and that conforms on page 3 and page 4. You will notice later on in the amendment, we also back up some dates down below. When you get to page 4, this is where I pondered actually convening a working group that delves specifically into our developmental preschool issue that we've spent quite a bit of time on in these 2 meetings. And this would simply ask that we set that effort aside and give it specific attention with respect to a successful transition. I think it's important enough, and we have discovered that there's enough heartburn there that I wanted to give the developmental preschool folks the opportunity and the time to work this through pretty carefully. And again, I think it's important that all of this information comes back in a good way. I think the good senator from Cheyenne has an amendment that will touch on that as well, that we make sure that this information gets back to our Joint Education Committee. But that's what that would do, is simply ask that the superintendent convene a specific working group. You'll see the date changes come up next on the amendment. And so that completes really Amendment 1. Mr. Chairman, I realized I kind of thought that this was to be considered as one amendment, but I see that on the screen it actually indicates Amendment 1, Amendment 2, Amendment 3, and Amendment 4. So I'm not sure what your desire is on that. I'll close out comments on Amendment 1, and that can be, we can take each up separately.
Thank you. I think that let's do them one at a time.
Okay.
Thank you.
My apologies, Mr. Chairman. I thought that the amendment really would be taking up all 4 of the issues, but that first issue just simply is a date requirement, and then the establishment of a working group.
Okay, so why would we push it out another 6 months other than just to maybe make the pain a little bit longer?
Well, Mr. Chairman, to answer that, I guess I would look at it in a different way. I just feel pretty strongly that that this is a big enough change after after operating the way we do for 30 plus years, I just want to make sure it's done correctly. And I'm not sure that this can be pulled off in a year and have everybody on board with where we're going. So I just, I guess that would be my defense of that amendment is, why not give it 6 more months, allow a working group to spend some time with this and allow our Joint Education Committee to be involved. And what is 6 more months? If it's worth doing, let's do it right.
Thank you, Senator Landon. Senator Ellis, you had a question. Go ahead.
Thank you, Mr. Chairman. I do think this is somewhat of pulling off a Band-Aid, and I think most of us agree there's some value in like ripping it off fast versus slowly ripping it off. I'm interested to know, I know that your constituency has expressed concern over this. So, does this proposed language make this transition a little easier for them to swallow, or is it really irrelevant? Maybe it doesn't matter to them. And so that's kind of where I'm weighing it. I mean, if this makes it easier for them, I'm willing to entertain it. But if it doesn't, then I think we should just pull the Band-Aid off fast. But I'm curious to know your thoughts, Senator Landon. Thank you.
Mr. Chairman, thank you. And Senator Ellis, thank you for that. That's a great question. I have spent quite a bit of time with my constituency, and you're right. You can tell that there is not a lot of support for this change in governance. But there was several times testimony that was given to our committee that indicated, let's slow this thing down. I took that to heart, and that's why it's reflected in the amendment. I believe that perhaps this might allow for them to come to acceptance a little bit better. They have not told me that. I think, generally speaking, I think my constituent senator are opposed to the bill as it stands and even with the amendments. But perhaps given a little more time and the ability to work on a working group with our Department of Education, I think that will help.
Senator Rothfuss, go ahead.
Thank you, Mr. Chairman. Senator Landon and I appreciate all the discussions that we've had and the work that you've done to try to get to the point where we can build some consensus around it. But I did want to ask about that consensus and follow up on the fact that it's really my concern. I'd be willing to delay if I thought we were actually going to get to the point where everybody came on board. And I guess my question is that going to happen? Because I don't get the sense that there's actually an interest in getting on board, getting to the point where we have something we all agree on. I just see, and again, it goes back to the fact that you and I have been working on this for 3 years, and I've never seen an interest in just trying to build a common path forward. I've seen obstruction and intent to provide uncertainty, fear, doubt, concern, consternation, whatever great $7 words we can throw out there that lead people to fear this change when, as you recall, when we started this, we just wanted to get to the point where we could improve the quality of early childhood education for all in the state. And we thought a good first step would be to try and get everybody on the same team. So, is this Amendment 1, is the extra time going to build a better product or get more folks on board?
Go ahead,
Mr.
Senator.
Chairman, Senator Rothfuss, thank you. I can't argue with anything that you stated. Very well done as usual. I don't know if this will help. I have spent quite a bit of time doing my best to try to get the whitecaps off the water, so to speak, and to help maybe bring the two sides together. A lot of things on my mind in that regard, but I would say that my constituency here, for the most part, has some real reticence in going this direction. I believe that this will help because it actually gives some time for all of those stakeholders specific to these developmental preschools to come to the table and work directly with the Department of Ed, with representatives from those other two agencies. And I just think I think we may have an opportunity for a better product because of that. You're absolutely right. You and Senator Ellis have hit the nail on the head. Can we complete it in a year? Probably. Is an extra 6 months going to do any good? I'm not sure, but I felt like that it might help to bring some people to the table.
Chairman Flintner, go ahead.
Thank you, Mr. Chairman. Senator Landon, what about Head Start? You don't specify them in your amendment, and I was just curious if that was an oversight or if you didn't feel they were necessary. And also, because I'm new to this conversation, I would like it if somebody could explain to me why the CDCs are so reticent to accept this change and this oversight, because I don't understand why they are opposed to it. Thank you.
So, Mr. Chairman, I'll take a stab at that, Representative Flintner. Very good questions. It was intentional that I drilled specifically into the CDC issue because I saw that as being the real blinking red light bulb when we reviewed this legislation in November. That was the constituency that had the most heartburn with the bill. The bill actually addresses the fact that the Department of Ed will work to establish rules and regs. And so they will be working with our Head Start folks and all of the rest of our early childhood programs anyway. What this amendment is attempting to do, and I hope that it might do, is specifically give more energy and time to this developmental preschool group that seems to have the most heartburn with this governance change. So I hope that helps.
Further questions? Go ahead, Representative Brown.
Mr. Chairman, not a question, more of a statement. I would, even though I seconded, and then I will continue to second the amendments here for purposes of discussion. I think having these discussions is well worth it. I'm on and against this First Amendment for a couple of reasons. First and foremost, I think we've been looking at this for 15 years, and I'm not sure that extra 6 months is going to garner any more support or any more belief that what's going to happen is going to be any different now, what we currently have versus another 6 months. So I don't see any reason for dragging this out an additional 6 months. I really don't. The other thing that I will say on this is you're doing that in the middle of a school year. That really kind of puts some things into perception there too, that you're doing some interesting work there in the middle of the school year that I don't know whether or not that would cause consternation at the department or not. But the other thing that I'll say on this is we're looking at the fact that this already is the Department of Education's responsibility. I don't see any reason why we would have the Department of Education have oversight of another agency with the Department of Health for an additional 6 months just to make sure that it looks better or whatever. I think we're going to see the same determination and the same discussions happen with or without that extra 6 months moving forward. I personally don't have much of a problem with the working group. I still stand firm in the fact that we've had a working group looking at this for many months and many years. We've had multiple working groups looking at how this has been done and how this would move forward. I see what the senator is looking at doing here is trying to make sure that the implementation holds true to that. And so, if we wanted to divide the amendment and go into all that, I don't think we want to go through all that. I think we need to move forward here. But I would say I'm against this amendment, this portion of the amendment as we move forward. I think we just, as Senator Ellis has said, we need to rip the Band-Aid off and we need to get moving. 15 years and stagnation has not done anybody any good at this point.
Further comments or questions?
Well, Mr. Chairman, just a couple of thoughts in that regard. And I appreciate the representative, especially appreciated that second of the amendment. That really helped us. So thank you, Representative. But I'm old enough and been around the legislature long enough to know that that not everything is as it is today. And we're very, very fortunate to have a superintendent that I think we all trust and has done an amazing job. And so I have no doubt that this will be done well as we go forward. I think it can be done better if we give it every bit of time necessary. And I respect both viewpoints. And I guess it's just a vote it up or vote it down. But I really believe that I've seen times, and part of the reason that this hasn't happened before this current superintendent to the representative is, quite frankly, we weren't set up very well in the Department of Ed many years over the past 25. So, and we all are very much aware of all of the things that took place with that. So, so those are the cautions. And I just, I think that if it's worth doing, then it's worth doing right. And it's worth taking our time to make sure that we get everybody on board. Thank you.
Representative Paxton. Chairman Paxton, go ahead.
Thank you, Mr. Chairman. I'm just wondering if it would be appropriate for us to go ahead and divide this. I think there seems to be a lot of sentiment that indicates that the date is the biggest problem with this particular amendment. And so I would ask us to divide the amendment with the date being separate from the remainder of the amendment.
Is that a motion?
That is a motion. Move it back to eliminate that and make it exactly as we originally had it.
Mr. Chairman, without objection, we wouldn't need a vote or anything on a motion. Just asking is sufficient without objection.
Mr. Chairman, just as a clarification also, there are two sets of dates in Amendment 1. If you'll notice, dates up top, and then you go down to page 4, page 10. So just for clarification, I believe that Representative Paxton intends for all of those dates to be separated from the working group. Is that correct?
That's correct.
Thank you. Just wanted to clarify.
Mr. Chairman, I think it would be appropriate to, at this point, have Representative Paxton or Chairman Paxton delineate which one would be Section 1, Amendment 1 and Amendment 2 there, or just so we can vote up or vote down those. But I think everybody understands what the delineation is.
Well, my understanding was that we're just voting on amendment number 1 at this time. Is that correct?
And we also need. Go ahead, Representative Brown.
Mr. Chairman and Representative Paxton, what I was saying is you're correct. It's just the division, which division of Amendment 1 you would want to take on first and vote on first. Division 1 being the dates, Division 2 being the working group.
Division 1 being the date, please.
Okay. Any more comments on Division 1? If not, we'll proceed to vote on Division 1. All those in favor signify by raising your right hand. Okay. All those opposed, raise your hand. I got 11 no's and 1 yes. That division has failed. Division 2. We'll vote on it. Go ahead, Chair. Senator Lannon, go ahead.
I'm sorry, Mr. Chairman. I was just saying question, but it looks like you have, Senator Rothfuss has something.
Go ahead, Senator Rothfuss.
Mr. Chairman, I do think it would be good to add language, and conceptual is probably fine, to make sure that we're including Head Start personnel in that little group so that we've got everybody. I think it looks like as it reads, it would get us the TANF folks, the Department of Family Services, Department of Health, just to make sure that if it doesn't already imply that we bring in the Head Start for that working group, that Head Start would be there, because obviously we'd want everybody involved in kind of planning for that transition. So I'd make a motion to include Head Start and provide flexibility to the staff to make that read as necessary.
Second.
Been moved and seconded to add in Head Start and the flexibility to make it read as necessary. Any discussion? Go ahead, Representative Connolly.
Mr. Chairman, if we're being really thorough here, which I appreciate, then I think we should add in the Department of Workforce Services as the fourth agency that's been part of the grouping that's going to be reorganized.
Call that a friendly amendment if it's okay with a second.
Yes.
Second shakes her head yes. All right. Any other questions or comments on it? Go ahead, Senator Landon.
Mr. Chairman, I appreciate my colleagues. I think that is all encompassing. If we pass this amendment to the amendment, my concern all along has been that we target specifically some of the consternation that we've spent 2 meetings on. And if this working group becomes larger and larger and larger, I just get a little bit concerned that the specific work is going to get done. But other than that, question on the amendment.
All right. We're voting on the amendment to the amendment. All those in favor signify by raising your right hand. Opposed, left hand, or raise your hand. We have 5 opposed. Is that right? 1, 2, 3, 4, 5. 5 opposed. So that motion passes. Okay, we're back on the amendment.
Question.
All right, question's been asked. All those in favor of the amendment, please raise your hand.
We
I got 12-4. Those against, please raise your hand. And 1 opposed. The amendment has passed. Okay, so now, Senator Landon, we're on amendment number 2, if you would, please.
Mr. Chairman, thank you. Amendment 2 goes into page 9, line 7. Insert 619B after the word section. And what this does is include our B and C funding. And we insert language on line 13 after the word division to early childhood providers, early childhood education providers. And all that does, all I was attempting to do, committee, is to give a little bit of assurance to that funding. I visited with a couple of our colleagues who did not serve on the Joint Education Committee, and one of their concerns was, if we move all this funding under the Department of Education, are we going to lose some of the funding in these early childhood programs? I took that to heart. I had a little bit of concern in that direction myself. And so that's what Amendment 2 is trying to do, is to just specify that this B and C funding is intended for these these early childhood education providers, and specifically the developmental preschool. So that is Amendment 2, Mr. Chairman, and I'd stand for questions.
Thank you. Does anybody have a question on amendment number 2?
Mr. Chairman,
Go ahead, Chairman Flintner.
just because I'm ignorant of the funding streams, so would it mean then with the inclusion of 619B, then it would still be, the money would still be coming from the Department of Education?
Mr. Chairman, that is correct.
Thank you.
Further questions?
Mr. Chairman, I'm not sure it's been moved and seconded yet.
Mr. Chairman, we kind of went with a moved in a second on all of these at once, underneath the understanding that this was going to be one large amendment.
Mr. Chairman?
Go ahead, Senator.
Just from a parliamentary standpoint, I don't think we should have done it that way if we did. I was under the impression that we were doing Amendment 1 and that the motion was Amendment 1 and that we'd have a separate amendment on the others. Otherwise, we should have done division and we're wildly inappropriate. So let's pretend we did it that way if we didn't.
Mr. Chairman, I'm okay with that if the bringer of the amendment's okay with that.
Mr. Chairman,
Wildly inappropriate.
Wildly inappropriate, yes.
They're finally appropriate, I think.
So, Mr. Chairman, I believe then at this point we would need a movement. So Senator Landon, if you would move that, I'll go ahead and raise my 2 fingers here.
I will move.
And seconded. Okay, so we're on the second amendment. It's been moved and seconded. Any more discussion? Senator or Representative Brown.
Thank you, Mr. Chairman. In an effort to be wildly appropriate here, I just wanted to have a little bit of discussion on this, and I appreciate what the senator's trying to do here. Mike, I have a slight concern with this exact language, and that would be that if you read this, it says all funds received by the state from the federal government pursuant to section 619C and B and reserved by the state pursuant to section F of the Federal Individuals with Disabilities with Disabilities Education Act shall be distributed by the division. And then if we include his language, this says to early childhood education providers. My concern about that is, what does that do, and would that potentially hamstring the use of these funds for anything outside of the early childhood centers? So we've heard that some early childhood centers do have 5 and 6 year olds, but would this potentially hamstring the use of these funds to the 5 and 6 year olds that are inside of the K through 12 system? And would that potentially cause any type of consternation? And I'm looking for some discussion. I would like some clarification on that if that's the case.
Senator Landon, do you have any clarity on that?
Mr. Chairman, I don't. I am not well versed on this couple of funding streams. That's probably a question that needs to be answered by the Department of Ed or the Department of Family Services. That assurance that money goes to our early childhood programs, I see where the representative is coming from. There may be an unintended consequence that we can't use that for any number of other ways, but just an attempt on my part with this amendment to lock down a little bit and give some assurance to our programs out across the state that funding is going to remain in place.
Agreed. Superintendent Balow, are you on?
Mr. Chairman, this
Please
is
go ahead.
Superintendent Balow, and I am on. And I'm going to pass that question to Director Robertson, if that's okay.
That's great. Thank you.
Thank you, Mr. Chairman. Senator Landon. The $611 and $619 come to the Department of Education in 2 grants. So we received the Part B 611 grant and the Part B 619. Both of those grants require us to use a formula to determine who receives those funds, and it's based on population and poverty as well as a base amount. And that is all stipulated in IDEA how we distribute those funds. I do have concern that if this bill were drafted or worded this way, that it may indicate that all of those funds must go to the CDCs, and it needs to be done based on the rules of IDEA and the distribution. So currently what happens is we get a count from CDCs from BHD as to the number of kids in the CDCs, as well as a count from the school districts. And then through a very tight calculation, it tells us how we distribute those funds, and we follow that in accordance with the laws. So that's currently how we distribute those funds.
Mr. Chairman.
Go ahead, Representative Brown.
Follow up on that, Director Robertson. So is it my understanding that there would be no opportunity if we did not include this language? There would not really be an opportunity for the Department of Ed to restrict funding to any particular CDC or anything along those lines, that this funding would stay basically identical to the way it is with or without this language. Is that right?
Yes, Mr. Chairman, Representative Landon, I do not believe that the change in the program, the dynamics of moving the team over to WDE should change the way funds are distributed because of the way IDA is designated. And because our CDCs are our providers for early childhood services to children between the ages of 3 and 5, that's how the funds are distributed.
So Director Robertson, my question would be, do we need to add the language to have the Section B money follow along, or is the C enough?
So, Mr. Chairman, I believe that, I can't speak specifically to the language as I'm not an attorney, and I would definitely want LSO to weigh in on this particular piece, but I know that currently under 611, those dollars are meant for the administration of early childhood services as well. So both 611 and 619 dollars currently go to the CDCs and should continue to go to the CDCs based on the requirements of IDEA. So I feel like IDEA already has mechanisms in place that ensures that we distribute those funds equally amongst our school districts and our CDCs. And I'm not sure that the wording is necessary, but I'm not sure that I would just caution some review of the wording to make sure that we're not limiting how we distribute those funds in a way that would contradict what's required under IDEA.
Thank you.
Thank
Chairman
you.
Paxton, go ahead.
Thank you, Mr. Chairman. I just think that this particular amendment is unnecessary. I think the rules are already set by IDEA, and I would encourage a no vote.
Further comments on the amendment, amendment number 2? Go ahead, Senator Landon.
Well, Mr. Chairman, I appreciate Chairman Paxton very much, and that very well could be. I just, this particular amendment was just to emphasize the fact that when we move this program over to a new agency, we expect all the funding to continue to go where we intend. And I'm not completely convinced that the funding can't be used in other ways, whether it be administrative or anything of that nature. So, vote it up or vote it down. But I think this is a concern with some of our colleagues in the legislature when and if we take this bill forward. I think that's one of the things that we're going to be asked about is tell me about the funding and whether or not it's going to be withheld from any of these programs out across the state. Maybe we have the restrictions in place. This would just simply make sure that we expect this money to go to these early childhood programs.
Further questions or comments?
Call for the question.
Question being called. All those in favor of the amendment, please raise your hand. I've got 2. All those against the amendment, please raise your hand. 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, that amendment has failed. Okay, Senator Landon, please proceed.
Mr. Chairman, thank you. Amendment 3 is probably a little more controversial, but it's something that I thought about over and over. What the amendment does is just simply adds a little bit more protection to these developmental preschools out across the state and other entities that might end up competing against government. As you can see, the new language that I am proposing would say no public school district shall be eligible to receive federal funding for an early childhood education program unless the district provides public notice that it intends to apply for federal funding and operate an early childhood education program at least 6 months prior to the operation of the program. In other words, if a school district is going to become involved in what is currently being done by our developmental preschools, I just wanted to put some protocols in place that would give ample notice to our communities out there and to those entities providing the services that our school district intends to put in a bid to provide those services. That's the intent of the amendment, and I'd be happy to answer any questions.
Thank you, Senator Landon. Any questions on the amendment? Go ahead, Representative Conley.
Thank you, Mr. Chairman. But first, I'm curious if we do need to do a motion on the amendment in a second before we take the questions, but I do have a question.
Good job. Thank you. Yep, need a motion on it.
Thank you. I would move the amendment, Mr. Chairman.
And we have a second from Representative Brown. So do you have a question now, Representative Conley?
Yeah, thank you, Mr. Chairman. And Senator Landon, I'm curious what this would do to, we have many school districts right now that do receive federal funding for TANF preschools. And so what would your amendment do to those existing programs?
Senator Landon.
Mr. Chairman, thank you. And Representative Conley, it wasn't my intention that any of the programs currently underway would be affected, but during bid processes, this amendment just simply contemplates the idea that that I just wanted to ample notice from our school districts if they intend to bid on something they're not already doing. You know, there are some provisions and testimony this morning by our superintendent have indicated to me that we're going to be careful on that front. What this amendment does is just assure that. So that maybe doesn't answer the question, Representative, adequately enough, but it was not my intention that it would interfere with programs already underway at the school district level.
Go ahead.
Yeah, thank you, Mr. Chairman. I'm concerned about that. And I'm not seeing any kind of grandfathering in language in the amendment as it exists, and not quite sure if that could happen. So just really a comment that I don't see the amendment doing exactly, Senator, what you had hoped for it to do, given your explanation. Thanks.
Go ahead, Representative Brown.
Thank you, Mr. Chairman. I would tend to agree with Representative Conley. And then one of my other concerns here is just spending some time in the executive branch. One of the things that I've noticed is you have hands going for these types of grants all over the place. And I would be concerned about creating a state barrier of sorts, if you will, for federal programs, saying, no, you need to check with the CDC, or, you know, the CDCs to make sure that they're not already doing this. And then there's really no authority at that point as to who can say, yes, you can, or no, you can't. This just says that they need to let people know. I feel like that's a layer of bureaucracy that's not necessarily necessary. I guess that was really bad English, but there's not a level there. And I think maybe I see exactly where the senator's trying to go. And maybe if we can work on something, because I understand exactly what he's trying to do here. Maybe we can work on this. Is the way the language is worded right this second. I don't agree with it. And I think maybe we can work on this once we get this bill moving forward. I'd like to work with the senator and see if we can find some language to bring forward during session for this.
Go ahead, Senator Landon.
Mr. Chairman, thank you. And, you know, Representative Brown, I think, brings up a good thought. And I'd be willing to withdraw the amendment if the second agrees. And maybe that's something that we can work on offline. I think everyone on the committee hopefully understands where I was trying to go with this. And as our education committee continues to work this into the session, if it goes there, you know, maybe we can really target that. That was one of the major concerns by our CDCs out there was, are we just setting this up so that it just becomes an extension of the K through 12 and our school district are going to take over all of these services? And so maybe we can work together, Mr. Chairman, and I would be willing to withdraw this amendment.
And I'll withdraw my second. And Mr. Chairman, with the withdrawal, I do think that I think this idea has some merit. I really do. And I think that there's some concerns from the CDCs that need to be addressed with this particular issue. So I absolutely agree. And let's, good Senator and I will work together on this.
Very good. Glad to hear it. Thank you, guys.
Mr. Chairman?
Yes.
Thank you, Mr. Chairman. Just to add on to this, I do feel like this is an extremely heavy hammer to withdraw federal funding. You know, as you rework this, you know, just wanted to weigh in that I think a better approach would be just say, we're going to require some notice and leave it at that. And if they don't fulfill that, then, you know, maybe they're ineligible to receive the grant. But throwing out a heavy hammer such as, withholding federal funding, I think is a little, it's just too much for me. And then along those lines, I would also like to know just what the notice requirements are in general for anyone that wants to apply for these funds. We should probably keep that pretty equal, would be my thinking, unless we have a rational reason for doing otherwise. Thanks.
Good. Senator Rothfuss, you had a question?
Thank you, Mr. Chairman. Just a quick follow-up on that. I think really anything that would preclude a school district from receiving federal funds on short notice is something that we would really have to be thoughtful about, the unintended consequences there. And you could think of the circumstances of the past year as a good example of that, where you've got emergency funding available. I wouldn't want Wyoming to have to say, no, I'm sorry, we can't take those funds because we have a publication requirement that's 6 months or something along those lines. So I don't know exactly how to craft that language so it meets good Senator Landon's interests without having those unintended consequences. But I know he doesn't want to preclude those types of considerations. So just another thought as that's being looked at. Thank you, Mr. Chairman. Thank you, Senator.
Senator Landon.
Mr. Chairman, good thoughts shared. Really appreciate it. As you all know, I will be moving off of the Education Committee, but we'll try to loop in the two good senators who might be willing, hopefully, to take forward anything that Representative Brown and others and I might come up with just to try to allay the concerns of some of our developmental preschools out there, some of our Head Start programs. If we're going to compete through the school districts with them, maybe we can find a little bit of a balance point in there that that has been alluded to. I appreciate the two senators.
Very good. Senator Ellis, you had an amendment that you also wanted to put into the bill. Would you like to discuss it at this time?
Sure, Mr. Chairman, and thank you. I just want to, before we leave this particular topic, going forward, if we do advance this legislation, I would love to hear from the people who currently oppose the bill, if there are things that we can do to work language and come up with ideas to make this a little bit more workable. I certainly welcome that, but I just want to make that offer known to the group. That, Mr. Chairman, I also had an amendment drafted. It's in your meeting materials, and this would go to page 8. After line 14, inserting a reporting requirement. Like many of you, I don't like it when we just add reports willy-nilly that go on for perpetuity and create more work. But I do think that it would be good for us to maintain some oversight for about a period of 5 years, just to make sure that this process, goes smoothly, making sure that we're keeping apprised of any developments. So this would add a requirement that we receive reports to the Joint Education Interim Committee by October 1st of each year on CDCs, and this would start, and it would be repealed after July 1st, 2027. So assuming that this would go into effect, we would have a 5-year window to look at the following information. We've heard about the number of formal complaints that have been filed against the Department of Health. I believe I read something that there was like 7 or 8, and only one of those had been dismissed. So our goal, I think, would be to see if transferring this to Department of Education would reduce those number of complaints, meaning that we're doing a better job of our compliance. The second piece that we would receive information on is an annual update on the number of students first identified as having a disability in kindergarten. We all share the goal of hopefully catching those students sooner. And so we've got some data we could look back on and see if we're actually achieving that. The third point would be data related to the use of least restrictive environmental education practices. And then finally, the number of services provided in high needs student categories reported by the region. And so, Mr. Chairman, I think that this, is pretty prescriptive. The first two, I feel very strongly about, knowing the latter two less so. But I do think it's important to monitor this for a while. And if we want to extend it, the monitoring, we can. If we wanted to shorten it, we could. But this at least gives us a snapshot of time where we can see if this was see how this went. Happy to answer any questions.
Let's have a motion on the amendment first.
Oh, I'm so sorry, Mr. Chairman. So I would move the amendments starting on page 8 after line 14.
I'll second.
We got 2 seconds. We got one from Representative Flintner, one from Representative Brown. Very good. All right. So now we'll answer questions or ask questions. Representative Connolly.
Thank you, Mr. Chairman. Senator Ellis, I am I understood your rationale for items 1 and 2, and honestly, that there could be comparisons that are done between what's happening now and what would happen with the move. I am, though, curious about 3 and 4, where you said you were less wedded to, about what kind of information that would give us in order to act.
Yeah, thank you, Representative Connolly. You know, I think that there's been a lot of discussion in this committee about what the least restrictive environment really means. And so I think that just having an, continual monitoring of that kind of information and being provided to us would be helpful. I don't think it's as prescriptive as the other ones that provide an actual number that show like, either we reduced it or it's stayed the same or increased. And so it's broadly an update. So we have a better handle on what's happening out there. But it doesn't have like a numerical metric, I guess is why I'm less excited about it, if so to speak. But I do think it's important for us to continue to receive that kind of information. Along those lines, we could be very open to entertaining deleting 3 and 4, but also making sure that the reports we receive have some flexibility. I'm sure, just because we ask for some data doesn't mean that we won't receive more or less, or more, I guess. But those 2 I feel very strongly about.
Mr. Chairman, with that, I'd move to divide the amendment and polling, make Division 1, basically 1 and 2 with the language supporting those. And then Division 2 would be 3 and 4.
Mr. Chairman?
Yes, go ahead.
Rather than divide it, I do think Category 4 provides the number of services provided, the high needs student categories, so we will have some basis of comparison. I think that, I'd modify my amendment so it would delete Roman numeral 3, and so it would just have the reporting requirements of 1, 2, and 4. But they'd be renumbered to 1, 2, and 3.
And
Representative Brown.
Mr. Chairman, you had 2 seconds. I don't know who the second was for the record. Personally, I think that I don't mind having that. I guess at that point I would divide and still look at potentially removing number 3. I really like the idea, so I would still move to divide, but I think as the chairman, you would need to make the call as to the change of the amendment from being 4 items down to 3 and all that kind of stuff.
Senator Rothfuss has a point, I'm sure. Go ahead.
Yes, Mr. Chairman, I just suggest that the amendment's not divisible, but it's certainly amendable. And I would encourage, assuming that the second accepts Senator Ellis's request to remove the original 3, which we'll assert, then I would suggest Representative Brown simply move to amend by striking what would then be the new 3 as a motion that would accomplish his objective for consideration.
Okay, so that everybody's on page, we have Senator Ellis has deleted her number 3, the original number 3, which is the data related to use of least restrictive environment education practices. That's been deleted. Do the seconds agree with that? That was Representative Flintner and Representative Brown.
Yes.
Yep, they're shaking their heads, yes. Okay, so the new amendment has only 3 Roman numerals in it. And the new number 3 is the one that says number of services provided in high needs student categories reported by region. That's where we are now.
And honestly, Mr. Chairman, at this point, I don't really, it's not that big of a deal to me. I'm not going to motion anything further. Let's vote this up and vote this down.
Representative Connolly, you got your hand up?
Yeah, thank you, Mr. Chairman. I do want to go back to number 4 and thinking about what it is that we would be getting. So the number would actually be a number, not 1, 2, 3, 4, or 5, right? Provided in high needs student categories. And so having served on recalibration and talking a lot about special needs students and those categories, we're talking about those with the most severe identifications. I'm not sure what getting a number in terms of those students will actually do or help this committee in terms of moving forward. And so again, I'm going to ask the question of Senator Ellis. What is it that you think we're going to get with getting a number with those students who are severely disabled is going to help in terms of the committee and honestly, the providers and the Department of Education, et cetera?
Yeah. Mr. Chairman, I mean, just, I don't want to overthink this. I mean, we're just trying to get a handle on how the transition's going. And I do want to know, you know, are we able to reduce the number of services by maybe getting some earlier interventions, or our number of services going higher? And so maybe it's a higher number. Maybe we clarify it to say the cost of the services. I was just trying to capture data that the Department of Education or Department of Health capture in this. So it could use some tweaking, but at the end of the day, it's a data reporting requirement. And I do want the committee to know that, you know, I know that there are opponents to making the transition. This was based off of some of the reports that we've received, and just, you know, as government goes, I want to see if this was effective and if we can make a difference. So it was intended to be broadly worded so that the department, if they, you know, if this legislation advance, that we get some information about services that are being provided to high need student categories. And I think that they capture that. And I don't know if it'd be appropriate for the Department of Education to maybe put a finer point on some of that and give you some information about the data they do collect. So, Mr. Chairman, maybe with your permission, that might illuminate this discussion better.
That might eliminate the delay. Go ahead, Representative Freeman.
I was in public education for 33 years, and one of the problems that you have with reporting specific numbers is coming up with student privacy. So if you have a regional area that has 4 students that are severely, that has severe problems, you can't report that, because what will happen is people who want to can figure out who those students are. And the other thing that happens is the school districts are, from what I experienced, is unable to provide those kind of numbers. So a report would probably be better than specific numbers. Thank you, Mr. Chairman.
Agreed. Go ahead, Representative Connolly.
Yeah, Mr. Chairman, I'd like to move in the same way that we did to remove 3, to also remove 4 from our consideration of this amendment. I think there are too many questions, and the good senator can kind of work to get that clarification for the future if we move the bill along.
Mr. Chairman, do we still have anyone from the Department of Ed in the waiting room, or that could be called upon to just answer questions about the data that's already collected and what we're hoping to maybe kind of get our arms around? And certainly the Department of Education, you know, assuming this bill moves forward, they're not going to violate. I don't share the concerns about privacy if there's aggregated information, but I see somebody from Department of Ed on here so they can clarify.
That's correct. We have Superintendent Balow back on. Go ahead, Superintendent.
Thank you, Mr. Chairman. And unfortunately, I cannot answer this question directly, but I will pass it to Director Robertson to answer.
Director Robertson. You're muted.
Margie, you're on mute.
Thank you, Mr. Chairman and Representative Ellis. Can you guys repeat the question? I got kicked off of Zoom for just a bit and was reloading as I heard the very tail end of Senator Ellis's, Senator Ellis's question. So if you could repeat the question about the data.
Senator Ellis, it's yours.
Mr. Chairman, it wasn't my question.
Mr. Chairman, I am not sure who brought the question, but it was about data collections and making sure. Okay.
Yes, it was about data.
Representative Connolly had questions.
Then, Mr. Chairman, my concern was that first, that this is wanting some comparisons with the Department of Health, it seems to me, going forward, which we don't necessarily have. And then moreover, that the way that it's worded right now is simply a number, right? 1, 2, 3, and I'm not sure how relevant that is, especially when we're talking about kind of the highest need students. I don't think that gives us any valuable information. And so I was concerned that it's a relevant element to keep in the amendment.
Especially when reported by region, so.
Yeah.
Thank you, Mr. Chairman, Representative Connolly. The data collected from the Department of Education comes in on our 684 report, and I believe the 457 that currently is reported from the Department of Health and would continue to be reported. And those data points that we collect do need to be reported to, obviously, OSEP and the U.S. Department of Education. And that's where we get these data points. Now, to the concern about the piece of data that Senator Ellis mentioned around the number of services that students are receiving in a particular category, what that speaks to is really the adequacy of the IEP that's being developed for those students. So our most high need students should be receiving services that meet each of their needs. And it has to be, you're correct in realizing that it has to be kind of reviewed on the per child basis, but this data point would be a broad perspective that would show the amount of services that students in our most high need category are receiving. And that is one of our concerns currently at the Department of Education, is when we look at our most high need students in the review of data, which I believe Hamill shared recently, there were 0 students receiving more than one service in some of those categories, which just means there's a misunderstanding about FAPE and what is required to be provided to those students. And so it's a measure of really the consistency of giving services to kids across the state, because that's what we're seeing right now, is that in some regions of the state, kids get a lot of service. In other regions, students get a very small service package. And it shouldn't be based upon where you live in the state, but it should be based on your individual needs. And so that's where this data point could possibly be helpful to the committee. But that's certainly up to you guys about what you would find meaningful and helpful in evaluating the program itself. Thank you, Mr. Chairman.
Thank you for that explanation. Okay, does that help? Senator Hutchins, do you have a question?
Yes, well, not a question, Mr. Chairman, maybe just a comment about something that was brought up earlier by Mr. Elliott, I believe. He mentioned that in some states, they started out with the Department of Education, and then they transferred them to the Department of DFAS. So I think this information that Senator Ellis is requesting can kind of help the committee or anybody decide whether we made the right decision to move it to the Department of Education in the first place, and or should we move it somewhere else? Just a comment. Thank you.
Thank you. So what's your pleasure, committee? How do you feel about old item number 4? Senator Rothfuss.
Mr. Chairman, I was on something else. If we've got other discussion on 4.
Okay.
Mr. Chairman, there was a motion. Representative Connolly made a motion to strike 4. So I think we need to either entertain a second and vote on that, or move on from that and let that die for lack of motion.
Thank you. We're back to that. And we do have a second. Senator Rothfuss has a second on it. So we're at striking the old number 4. Is the motion?
Question.
Thank you. All those in favor, raise your hand. 1, 2, 3, 4, 5, 6. I have 6 in favor. Those against? 1, 2, 3, 4, 5. There we go. 1, 2, 3. Yep. 5.
6, Mr. Chairman.
6. I'm missing one.
Yeah.
Okay. So I'll vote against it. So that motion has failed.
Mr. Chairman, Senator Hutchins.
Senator
Thank you. I just wanted to clarify, when Senator Landon withdrew his amendment, did he withdraw the whole amendment or just the amendment we were talking about? Just kind of lost track there. Wanted to make sure. All 3. Okay, thank you, sir.
Mr. Chairman?
Go ahead, Senator Rothfuss.
Thanks, Mr. Chairman. To clarify Senator Hutchings' question and Senator Landon's response, Senator Landon withdrew his third amendment. The first two were as they were left, where we passed a portion of the first. I believe we did not pass the second. So that portion of the first stands as it originally had, and then he withdrew the third for further consideration. And Mr. Chairman, I do have a motion for an amendment, and we can vote this one up or down, but to me, this amendment is better in the non-codified section of statute, which would be section 1, as opposed to in statute, because it's a self-expiring request for reports. So I would move that we move it to a paragraph G, which would effectively be on page 4 and in the non-codified section 1, and then request that staff wordsmith the language of the first paragraph to make sure that it stands alone appropriately and accomplishes just exactly what it currently accomplishes. And the whole point of that is just keeping our green books a little bit shorter.
You have 2 seconds on that amendment, so we're good on that motion.
Question.
Mr. Chairman,
Go ahead, Senator Ellis.
I just want to hear from LSO about just drafting conventions, because I mean, it is a 5-year, and it is a, depending on when we do the transition, assuming we give them plenty of time to make it, and then a 5-year reporting, I do worry sometimes about non-codified sections being followed. And so it is, I understand the good senator's desire, but there is something about seeing it in the Green Book versus session law. So if LSO has I'm just kind of curious where they are. I just kind of want some feedback about that particular motion.
Mr. Chairman.
Go ahead, Josh. Thank you.
Senator Ellis, we certainly have things in non-codified law that go out for 5 years or more. I think the thought initially was to include it here. And we also have similarly, we have things in statute that then are repealed at a later date. So can certainly be done either way, Mr. Chairman. Policy of this committee. But yeah, I think I initially put it here just because it was out for 5 years, but certainly could be done either way.
Mr. Chairman, I would just urge rejection of the motion, just because if it were a 2-year period or a very short period where we're kind of keeping an eye on it for a little bit, it would make sense to have it just in session law. But because it's got a little bit of a life, I'd prefer it in the Green Book, and then when it expires, then it can be removed. Little paragraph.
All right. We have a motion on the floor right now.
Question.
Senator Rothfuss, would you like to re-edify your motion just so that everybody's clear?
Sure. Thank you, Mr. Chairman. My motion would just be to move this from what would be codified statute into section 1 as a new paragraph. I believe it would be a G paragraph in the non-codified statute, and allow the LSO to make sure that they conform the language as appropriate to accomplish the original objective of the amendment. And I just follow up by saying that there are plenty of things that I know of that are very diligently held to in non-codified statute for many years, beyond 5. So I don't see any danger of that. Honestly, I'm just barely supporting the amendment as it is, and the idea that we're going to put a bunch of reports into statute, I'm never enthusiastic about, but I guess I'm okay with it being non-codified. So again, vote it up or vote it down. Thanks.
Okay. You've heard the motion. All those in favor signify by raising your hand. 9 in favor. Those opposed? 3, 4 against. That motion's passed. Okay.
Mr. Chairman, I have a very quick amendment if I could. Unfortunately, I don't have anything prepared to bring or to show everybody on the screen, but it's a fairly certain and straightforward amendment. It is on page 2.
Mr. Chairman, I believe we haven't voted on the amendment yet. My amendment.
Yeah, I think that we're still back on the amendment from way back when. There's one in there that got lost.
You're right, Mr. Chairman. My apologies.
You're all right. So we had amendment way back when that was Senator Ellis's.
Question.
Okay, all those in favor of Senator Ellis's amendment, please raise your right hand. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 11. Those opposed? Okay, that motion has passed also. Now we can go to yours. Go ahead, Representative Brown, page 2.
Thank you, Mr. Chairman. My sincere apologies, Senator Ellis. We got a long ways off there, so my apologies. Page 2, line 18, there was an email sent to me by Senator Cost and some of the concerns that had come out of moving all personnel and property and equipment and all of that from the Department of Health to the Department of Education. There was no intention on moving the public health nurses. So keeping those public health nurses within the Department of Health is what they were trying to do. So my amendment would read as follows on page 2, line 18, after health, insert, provided that no positions, personnel, property, or equipment associated with the home visiting programs shall be transferred from the Department of Health under this section.
Second. I'll second it.
And thank you, Mr. Chairman. And again, it's pretty self-explanatory. This is just trying to keep the home visitation program and the public health nurses within the Department of Health. What we're trying to fix here is not having one agency overlooking another and vice versa. So we're just trying to keep those two delineated and keeping the public health nurses. So if there's not any questions, I'd call for the question.
No questions? All right, let's vote on it. All those in favor of the motion, signify by raising your right hand. All those opposed? Motion passed unanimously. Thank you. Any other motions on the bill?
Question on the bill. Oh,
I get 2 more. Representative Simpson.
Apologize for belaboring the amendments. I believe I have an important one. However, I'd like to direct your attention to page 8. Paragraph E, line 2. Chairman, as I've listened to the directors of the CDCs, I've tried listening to their comments and trying to understand what the reservations are. And we've talked about the issue that this is just administrative. It shouldn't have minimal impact on them. But if I was a CDC director, this paragraph E would cause me great consternation. What we're saying here is that now, after the shift, the superintendent will have the opportunity to establish minimum standards and approve policies and procedures for programs and facilities. Again, if I was a director, that would cause me great red flags because as we reflect on their CDCs, they're independently operated. They all conform to uniqueness associated with their communities. They all have staff with different talents and different capabilities, and they perceive the needs of their communities. And Superintendent Balow, I love her and I love her background. I know she has pure intentions with this program, but I'm worried somewhere down the road when she is not reelected and someone else becomes a superintendent, I worry that giving the Department of Education the ability to establish minimum standards, that's really where I'm choking on is line 2, minimum standards to impose upon the CDCs. We use that minimum standards a lot in education world, but I would submit to you that in establishing minimum standards for the CDCs may not have the appropriate applicability. So, Mr. Chairman, my motion is on line 2 of page 8 that we would strike the words establish minimum standards and then put a capital on the word approve. I'm okay with approving policies and procedures, but I am really hesitant of establishing minimum standards for CDCs at this point in time, maybe someday in the future, but That's my motion.
It's been seconded by Representative Brown. Go ahead. Senator Ellis, you have a question?
Could you repeat that, Mr. Chairman?
That it was represented by, or Representative Brown seconded the motion? Is that what you're asking? Or are you asking Senator Ellis who repeated what? What are you?
Mr. Chairman, can you have Representative Simpson repeat his motion, please?
I can certainly do that. He would like to, on line 2, page 8, starting at section E, strike establish the minimum standards and then we will capitalize approve. That is the motion. Representative Freeman, go ahead.
Thank you, Mr. Chairman. I don't know if there's already minimum standards that are established by someone, federal government, the grants that they apply or any of that stuff. So I'd like to have some more information on that if anybody knows. Thank you.
That's a good point. I bet we need to ask Director Robinson where that lies. Superintendent Belo, can you enlighten us?
Thank you, Mr. Chairman. I appreciate the question, Representative Freeman. You know, I guess first of all, the federal law does require policies and procedures already that we'll make sure and have in place. So in a way, this kind of does double duty with the state transparency and requirement as well. And there are also licensing requirements that need to be followed. Minimum standards, there are a couple of ways to look at this if we're looking at academic standards or care standards or what have you. But I think the idea to put it in there, again, Representative Simpson, Representative Freeman is fine. We can work with it. If there are issues with alignment between this and our federal requirements, we can continue to address that and require and think about how to work around that and make a recommendation that kind of addresses both, if that makes sense. I'm sorry I'm bumbling. I understand the intent of this, and I think it's well placed. It's just that a lot of it is already in federal law and what we would do anyway, and what we would do maybe with some more efficiency.
Senator Ellis, go ahead.
Mr. Chairman, I move to amend the amendment, and rather than have approved policies as their duty, have them review the policies and procedures as their duty. It just seems that sending the plan and approving it it's a little doesn't mean a lot to me. But if they're reviewing it for compliance, then I like the word review better than approve. So that's the amendment, a proposed amendment to the amendment.
Mr. Chairman,
go ahead.
If you're looking for this to just be a friendly amendment, I would agree with that.
So that it now reads that we're going to strike the minimum standard and then strike approve, and put in review in place. Is that what you understand? Is that what you're saying, Senator Ellis? Good, thank you. Does the second agree? Yep, second agrees. Okay, Representative Connolly, you had your hand up.
Yeah, thank you, Mr. Chairman. A question for Representative Simpson. Representative Simpson, to me, this looks like language that is related to the transfer from the Department of Health and the Department of Workforce Services to the WDE. And that this is obligations right now of DOH and DWS that now the WDE will be doing. And so I'm just curious about why we would modify it to that extent when it's already being done, but just through the agency that's now responsible.
Good, Representative Simpson.
Thank you, Mr. Chairman. Representative Conley, I'm just taking the sentence at face value. It says that the superintendent, under paragraph E, will establish minimum standards. I think that's just too wide open for me. I mean, they could establish standards for the CDC policies and procedures. They could establish minimum standards for the kiddos. It's just a wide open statement that says, okay, we're going to start forcing the CDCs to do some level of perfection within their program, that the CDCs, because of their nature and rural opportunities, that they just can't perform. So it puts them at risk of literally being ostracized and being closed down because they could not meet this austere standard that Cheyenne has set.
Mr. Chairman, follow up. I mean, my question really is, do you know if this language is really just pulled where it's from the obligations or the duties of the director of the Department of Health or the Department of Workforce Services? So for example, we know that the Department of Workforce Service is obligated to have policies and procedures for the certification of facilities. So I am just curious, is this language that is just pulled from the obligations of the directors of those other agencies?
Mr. Chairman.
Go ahead, sir.
I do not know where this language came from, but even if it is just randomly pulled from other agencies, it still creates an opportunity that I'm uncomfortable with.
Senator Rothfuss.
Thanks, Mr. Chairman. On and against the amendment proposed, and I guess what it comes down to is a concern that there's two things to be concerned about here. One is that we have overly onerous regulation of the CDCs and that we are overly restrictive on what they've done, and those that have been successful in the past will have more burdens potentially with this language. That's one consideration, and I do believe that this language is basically already assumed elsewhere in statute where minimum standards will be created. But then the other side is that we don't regulate CDCs, that we remove minimum standards. And given a choice between eliminating minimum standards for CDCs, which basically means we're going to give you state money, with this amendment, at best, we'll review what you're doing. We won't say anything about it. We won't set standards that govern it. We won't have minimum requirements for how you manage these developmentally challenged students that we're paying state funds for you to educate, but we'll take a look at the report. To me, that's insufficient. And if we are providing state funds, and often we're using federal funds and we're working with an IDEA, I think we have an absolute obligation as a state to make sure that anybody we're providing state funds to support our developmental programs and special education in the state, particularly for our youngest and most vulnerable students, we need to make sure that those funds are being used appropriately, they're being used efficiently and responsibly, and that the programs that are operated are operated with appropriate standards, policies, and procedures in place. So to me, this is a critical requirement. And whereas before we were doing this through Family Services, Workforce Services, and the Department of Health, probably a little bit of a hodgepodge, and I'd assume that some of it would be Department of Health, we need to make sure that this does take place. I would be very concerned if we just removed any requirements or standards from CDCs and just let them take the $8,700 per student, go forth and come back and provide us with a report that we can review.
Representative Paxton had his hand up.
Thank you, Mr. Chairman. I wonder if we could ask Josh what the origin of that particular language is.
Yep, I think that's appropriate. Josh?
Mr. Chairman, Representative Paxton, I don't recall exactly. I'm guessing this there was a draft language that was provided by the task force and was also likely large portions of it were taken from the bill as it was drafted last time. I would assume it came from that, but I don't have that history right in front of me. I can certainly get back to you.
Okay, Senator Ellis, you had your hand up. Do you have a question, comment?
Thank you, Mr. Chairman. I guess maybe for the department, I I think I just heard that they're obviously federal requirements. So if we remove the language, and my goal would be for the WDE to review for compliance. And if they're not compliant, I don't think they just throw up their hands and say, oh, the law's not being followed. I think that there's got to be other areas in our statutes that say, that give the agency and the superintendent the authority to ensure that there is compliance before those funds are released. So I'm not as concerned about removing that piece of it, as long as there are federal requirements. So I guess that's my first question. And then the second is just ensuring that the department does already have kind of broad tools to ensure compliance with all federal laws.
Superintendent Belo, would you like to?
Yeah, thank you, Mr. Chairman. And just a broad brushstroke answer. We do have the tools to make sure that we're in compliance with federal law, not just with IDEA, but in all areas. And we also have some additional guardrails and guards helping us ensure that. So, you know, I'm not necessarily sure. I appreciate the intent, and if I'm understanding it right, it's really to raise the bar and raise the expectations, which of course we want as well. The bar is set by IDEA, and I'm not sure that this would necessarily move that or raise it higher, but we would. You know, we will review it and we'll continue to work with you if there's some misalignment or if we think that it could be strengthened, knowing that our goals are the very same.
Representative Freeman.
Thank you, Mr. Chairman. Can you tell me what happens if a CDC or any other agency that's dealing with pre-K children do if they haven't hit the standard? So what kind of enforcement is already in place? Thank you.
Superintendent Belo, can you answer it or should I go?
I'm working on it. Thank you, Mr. Chairman. Okay. So there's obviously a number of actions that we want, corrective actions and coaching opportunities that we would want to take as a state and as a CDC to ensure compliance, quality, and performance. Ultimately, and worst case scenario would be that a CDC isn't allowed to continue operating. However, there's still a federal requirement to provide free and public education immediately to students who need services across the state. And so we would not be negligent in, we would be negligent if we weren't able to continue providing those services. And there are multiple measures in place to make sure that that continues if that were to take place. We would know long before that happened, before a CDC was closed down for non-compliance. And again, we would hope, and our goal would certainly be that that never happens, and that we pull out all the stops to approach a CDC that is low performing with corrective actions and coaching so that they became high performing versus being closed.
Very good. Representative Simpson.
Thank you, Mr. Chairman. We probably can move on. We've probably all made our minds up. I would submit to you that we as legislators and bureaucrats, we have a tendency of wanting to micromanage and to just put always controls on everything. And I'd submit to you in this application, we've got plenty of controls in place. We would actually be putting something in the statutes that really could, somewhere down the road, could be an abusive situation. I don't think it's necessary. I encourage you to vote aye on the amendment, and I call for the question.
Question being called. Senator Rothfuss, you have a point?
Thanks, Mr. Chairman. Before we go to the question, I think it's important to realize this is not a bill that is just about CDCs. I think 98% of everything we've talked about has been CDCs because they've provided a lot of testimony and they've been the center focal point. This is also about TANF. This is about coordinating with any other program, trying to work with school districts. And again, this particular paragraph is focused on all early childhood education programs and minimum standards for those programs that are receiving state funds. So I think it's broader than just the discussion that we've been targeting. And I don't know that there's anything else. I do know that for CDCs, we're going to have IDEA coming down, and then we're going to have enforcement mechanisms as Superintendent Balow. And when I say that, I say that I believe that. I don't know where in statute that is. I don't know exactly which authorities there. I don't have enough clarity on it. Obviously, special education is an incredibly challenging area. But I have no confidence necessarily without this that authority and the requirement for minimum standards and everything else exists for non-CDC related early childhood programs. And so I think there's more to this. I do understand Representative Simpson's concerns here, and that he doesn't want to micromanage or overmanage. I'm very sensitive to that also, and I appreciate that thought. But I guess I'm still sensitive to the fact that we're taking away too much, and the unintended consequences are of concern, because I think we all agree that we really want high quality education for early childhood when you're using state dollars. I don't think there's anybody on this committee that would disagree with that. So I still continue to have that concern, and I'm sorry that I sort of swept in after Representative Simpson. I'd invite him to respond, and then I'll stop. I won't respond afterwards. But I just wanted to point out that last little point, because I think it was lost in the fact that the focus has always been on CDCs. So I'm sorry for that final intervention there, Mr. Chairman, and my apologies to Representative Simpson for swooping in after his final speech.
All righty, and Representative Paxton had his hand up also. Nope.
I'll take his place.
Okay, Senator Hutchins.
Thank you, Mr. Chairman. I'll take Representative Paxton's place. Just a quick comment. We're hearing over and over throughout the testimony that this is just a governance change, and it's going to be seamless and nothing's going to change. And I think this amendment is so vital, because it allows those who may be uncomfortable with the verbiage to say, okay, I may be able to agree with this now. So I think it's very important that we establish that the people that are providing the services will still be able to provide what we've heard already was excellent care of their children. Thank you, Mr. Chairman.
Thank you, Senator Hutchins. All right, we have two hands up. Senator Ellis, go ahead.
Thank you, Mr. Chairman. Right now, we already have this program up and going and administered through the Department of Health. Does the Department of Health not have minimum standards already? Again, I feel like this is just a handoff. And so that's kind of to Representative Simpson's, rationale for bringing the amendment. I guess I'd like to know that. And then the second piece of it is when it comes to establishing standards. I mean, are we talking about a rule promulgation? And if that's the case, which I feel more comfortable with, honestly, if we're going to have standards, they should probably be promulgated by rule and have a public process and all of that. But right now we just have established. So that could be, writing a memo and putting it out there on the internet. So just unanswered questions, which is why I tend to, at this point in time, support the amendment, because it says to review. And if we want more clarity down the road, those would be the points I'd want addressed. But if anyone has any information about Department of Health, or if they have rules promulgated that provide minimum standards, I'd be curious to know that.
Representative Brown.
Thank you, Mr. Chairman. I tend to harbor some of the same concerns about the established versus not established, but my bigger concern here actually lies with who is ultimately responsible for the funding that comes from the federal government. And that lies with the superintendent's office, regardless if this is Superintendent Balow or any superintendent here from the near-born future. What we have at this point is somebody who is now being told, well, you can review some of these minimum standards, but you cannot establish these minimum standards, but you are ultimately directly responsible for these standards that are set outside of your authority. And I think that's similar to what Senator Rothfuss has been saying, is that we're really sitting in a situation right now where we have more than just CDCs in this discussion. This is a broader discussion and a broader topic. But one of the things that I did hear is that this is a a large swooping change and everything's going to change over here, and that everything is being provided by Good Care, I would challenge that, because what we have seen is we have seen reports, a few different reports now, that the CDCs have not provided the adequate level of care and or education. And those are why we are looking at doing this. We have had reports sent to us as late as November, and we have looked at that as a task force, that some of these issues are why we are doing this. We have a superintendent's office that is responsible for these default issues, and only a few of them have been corrected. And unfortunately, the superintendent's office is writing these corrective action plans, and then they have to be administered by another agency. And so that's why we're doing this, is we're trying to get those corrective action plans to be administered by the agency that is putting them in. So I think that we are in a situation right now where I understand where Representative Simpson and Senator Ellis are in agreement with this, but I would urge caution that just reviewing these plans is not enough. We certainly need the superintendent's office to have the ability to promulgate the rules if we need to change those wordings. But this ultimately lies on that office's shoulders. And I certainly believe that we need to make sure that that office has the capability of enforcing what those minimum standards are.
Very good.
Mr. Chairman.
Yeah, go ahead, Representative Simpson.
Representative Brown has just blown my mind. That clearly is an elephant in the room that not one person has brought that to the table, that there's issues with quality of CDC activity. I think it's way late in the game to be throwing that on the table and to be discussing at this point in time. I still stand by amendment and would now ask for the question.
Very good. All right, anybody else?
Mr. Chairman, Josh has his hands up.
Josh, go ahead. I'm sorry. Thank you.
So, Mr. Chairman, earlier there's a question as to where this language had come from, and then also a question as to whether the Department of Health might have rules on this. And so I did find this language, I believe, came from 9-2-102A3 for the Department of Health. And it has basically a very similar language: establish minimum standards and improve policies and procedures for the establishment and operation of, and then there's kind of different programs. This is more than just this program, but community-based mental health, substance abuse, and developmental disabilities programs receiving state support. So I believe that's where this language came from, Mr. Chairman.
Thank you, Josh. Okay, we have the question called. I'd give a chance for somebody to say anything if they want. None appearing. All right, we're going to vote on it. All those in favor of the motion, please raise your right hand. Okay, those opposed? 1, 2, 3, 4, 5, 6. It has failed, 5-7. Okay, we're on the bill. Any more amendments? Representative Landon, or I'm sorry, Senator Landon.
Chairman, thank you. I don't sense that there are any more amendments. I just had a couple of comments, but I'll back up for a moment and so you can make sure there's no other amendments.
Further amendments on the bill? Anybody? None appearing. We will, Senator Landon, if you'd like to make comments on the bill, please do.
Well, thank you, Mr. Chairman, and I'll keep it brief, but I do want to say I've appreciated today's conversation, and I think it hits home the fact that this is an important move that we're perhaps going to push forward, and I trust in the two education committees to do good work in the session if we do forward it. I'm going to support the bill, Mr. Chairman, even though I fully understand some of the consternation of constituents all across the state. Change is difficult, and this is a big lift for some of them. But I'm going to support it simply because I think there's room for us to continue work on this bill. And I want to make sure that it's done right, and I think we can do that. I just like the work that is being done by the CDC in our community. I really believe that it's probably the lead ship in the effort, but my concern is going to be that we work this bill into form so that we don't hamper in any way what some of our good CDCs are doing at the expense of some of those who are not measuring up. And so thank you, Mr. Chairman.
Thank you, Senator. I'd also like to thank Lachelle, Becca, Elliott, and Senator Cost for their work on the committee. The guys did a great job getting it to us. Thank you. Further comments on the bill? If not, proceed to vote. Go ahead, Josh, call roll call, please.
Okay, Mr. Chairman, this is for 21 LSO 270 as amended. Senator Ellis.
Aye.
Senator Hutchings. Senator Hutchings.
No.
Senator Landon.
Aye.
Senator Rothfuss.
Aye.
Representative Brown.
Aye.
Representative Connolly.
Aye.
Representative Flitner.
Aye.
Representative Freeman.
Aye.
Representative Obermueller.
Aye.
Representative Paxton.
Aye.
Representative Piperinen.
No.
Representative Simpson.
Aye.
Co-Chairman Coe excused. Co-Chairman Northrop.
Aye. Thanks, Josh. Right, we had 11
Chair.
ayes and 2 noes. That motion's passed. Thank you, committee, for doing one more day's work for the people of Wyoming. Thank you for being a great committee. Representative Paxton, you have a question or a comment?
No, I just have a comment, Mr. Chairman. I'd just like to thank all of the members of the committee that will be moving on to new and better things. Some of you have been appointed to chairmanships. Others of you have decided to really retire this time. And so I just want to let everybody know what a fantastic job you've done over the years. And you're not off the hook because I have your number on speed dial.
Thank you, Jerry. Go ahead, Albert.
Mr. Chairman, I'd be remiss if I didn't say, when I first came in the legislature, I came into this committee with you and Paxton, and Kathy was there, and Gary Piperinen was there, and John Freeman was there, and it remains the funnest committee I've ever been on, for people and for the things we got done, I think. And so I just really appreciate all that you all have done for making a better education system in Wyoming, and for your friendship over the years.
You're here. I agree. Speaker Harshman, go ahead.
Hey, good morning, Chairman. I want to add my appreciation. You've served 8 years, been a really, really great chairman, really done a great job, and been a mentor to so many people. Appreciate your service. Representative Freeman, I think 10 years, done a great job, been a lifetime of service, and the same for Representative Piperinen. And you three have really done a great job on the House floor. It's been a real pleasure to serve with you, and again, wishing you all the best, and appreciate your friendship and all your service. So thank you, and on to a great 2021. Thank you, gentlemen.
Thank you, Mr. Speaker. Anybody else? Senator Ellis.
Thank you, Mr. Chairman. We are missing our Senate chairman today, Hank Coe. And if he's watching or plans to watch this, I hope you're not. Please don't watch a legislative hearing on your free time. But he's just done an extraordinary job leading us in the Senate. We wish you well. We're going to miss you. And I know I was visiting with Senator Rothfuss, and we are looking forward to a summer where we can come to Cody and celebrate you. So put that on your calendar. We certainly missed you today, and just appreciate all that you've given all of us in the Senate chambers over the years.
Here. Representative Connolly.
Thank you, Mr. Chairman, and you know I do this. In fact, I think it was the last meeting that I moved that we actually have this as a real meeting, in part so I could get mushy one more time. And so I want to thank, John and Gary, you, Dave, and Hank out there for all of your service, all of your work to making education as good as it is in Wyoming today. And to know that you have, each and every one of you, been a big part of it. I appreciate your service and I appreciate your friendship, and just know how much I'll miss you. And thank you.
Thank you. Superintendent Belo.
Mr. Chairman, perhaps highly unorthodox to allow a statewide elected to speak during the legislative meeting, but I too would like to extend my gratitude to both you and Chairman Coe. When I first came in as state superintendent, of course, the committee was chaired by Representative Patton, and you took over for him shortly thereafter. And I remember the sigh of relief that I had at the moment that I knew you would be chairing this committee, Mr. Chairman, because of your level head and your willingness to listen. I also remember my sigh of relief at knowing that Senator Coe would remain chair with his wisdom and experience. So I thank you both for bringing me along as state superintendent, and to all of the members of the committee who are moving on to bigger and brighter futures, whether that be in a different committee or in retirement from the legislature. I thank you for your hours spent understanding these complex education issues and truly and always putting children first. It's an honor to serve alongside you, even though we are in separate branches of government. And it's an honor to consider many of you colleagues as well as friends. Thank you, Mr. Chairman.
Thank you, Superintendent Belo. It's been an honor to work with you. Go ahead, Chris.
Thank you, Mr. Chairman. Mr. Chairman, I want to join the chorus of appreciation. And your work over the last 8 years has been, I think, incredibly supportive of the efforts of this committee. It's just been a pleasure to work with you and get so much done over the years. And I really do appreciate what Superintendent Belo mentioned, which is just your level head and willingness to listen at all times over this time. It's allowed us to do great things and to do it in a way that, as Representative Summers mentioned, has always been fun. This has been a great committee, great collegiality, great camaraderie, and I've enjoyed serving with you on it. I want to extend my appreciation to John Freeman as well. We've served on a lot of education committees together, this committee and other school facilities and other work over the years. And Representative Pete Berinin, Gary, I've enjoyed your wit and wisdom over the years as well, and serving with you, sharing some laughter and conversation on the side. So thank you for your service to the committee and the hard work, not just here in the education committee, but in the classroom as well, bringing that valued opinion to the committee. So we've had great service from each of you. And I don't know if my good friend Hank Coe is listening or not, so I'll keep it short in case he's not. But my good buddy Henry Huddleston Rogers Coe was my mentor when I joined the legislature a decade ago, and he's somebody that will truly be missed for me, but I know for everybody as well. We all love Hank and appreciate what he's done for the state. A man who's provided 32 years of service to the Senate consecutively. And as he points out, without having to serve in the House to develop bad habits, which he'll tell you every time. Hank has chaired this education committee for longer than I think most any of us have probably been on it, with the exception of, I think, Representative Harshman was there that long ago, potentially, but maybe not. And he's built this system of education that we all cherish, and he's built the system of education that my kids enjoy, and we all take pride in this education system, and we all share in that responsibility for developing it. But he's the man who led it. And that's really an incredible achievement. It's one that, there's been 1,000 senators in the state of Wyoming, and I don't think very many of them accomplished more than Senator Hank Coe. So I think we'll all miss him. Each and every day when I look across the Senate, I'm on one corner, Coe corners the opposite corner in the back so we can sneak out. And, I'm going to miss looking back there and seeing his support and his collegiality, his loyalty. We served on minerals together every year, education together every year, school facilities every year, but 3 recalibration committees. And I expect to see him when I travel around the state. And perhaps most importantly, we were together on the subcommittee on municipal solid waste. We were the Senate's garbage men for 2 years. I think we did a bang up job there. So Hank, if you are listening, I will miss you. I appreciate your friendship. I appreciate your mentorship. I appreciate everything you taught me about the legislature from the beginning up until this year. And as Senator Ellis said, and I've talked to Senator Landon about this as well, we want to mount an expedition to the great city of Cody as soon as we are able to share some time with you and thank you in person for all that you've done for all of us. So my heart goes out to you, buddy.
Hear, hear. Senator Landon.
Thank you, Mr. Chairman, for just a few more moments. I certainly cannot and never have been able to top Senator Rothfuss, but I have been able to at least ride alongside. And I wanted to tip my Stetson to some great friends. John Freeman, you've been a terrific buddy in all of this, and Representative Piperinen, really appreciate all the work that you've put in. We're going to miss you guys. It's been a good ride on education. Chairman Northrup, we have co-sponsored many bills together, and I'm really going to miss having you down on the other side to keep an eye on things, and wish you all that is good in the next chapter, whatever that is. But I also want to spend just a moment to give a special tip of the hat to my good friend, Senator Coe. He's my mentor as well, and somebody that I've looked up to since the first day I arrived in the state Senate. Thinking about all that's been said here this afternoon, I can't top any of it, but I would say this. We're talking about individuals leaving us today that are larger than just those who sit in those chairs. And I think, I especially think of Senator Coe when I think about this. What we're really going to miss in the Wyoming State Senate is his ability to calm the waters. When Senator Coe stood up in the back corner of the room, he just seemed to have such a great way of tying the strings together, calming everybody down, and getting us back on track. He's the heart and soul of the Senate, always has been. And boy, is he going to be missed. So I want to send my very best to Senator Coe and tell you that wherever you end up, Senator, I'm going to find you, and we're going to sit down and have some beverages and reminisce about accountability and K-3 reading and all the things that we've worked on together. Chairman Northrup, thank you for everything.
Thank you, Senator Landon. Representative Brown, you had your hand up?
Just briefly, Mr. Chairman, I want to say thank you to you specifically. You took me underneath your wing as I came in, ready to show this world a thing or two about education that I knew nothing about. And you've really led the way for me. And I appreciate your mentorship, and I appreciate the camaraderie that you've provided. So, I can say the same to Hank Coe. I've had many chances to have conversations with him over the phone, and those discussions will be sorely missed as far as, having the ability to stay engaged. And I think he's focused on other things right now, and I think he should be. And I think all of us, our hearts are are with him, and our thoughts and our prayers are with him as well. But in all actuality, I am excited for Chairman Paxton to come in. I'm excited for House meetings to actually flow easily, and you know. I couldn't even say it with a straight face, Mr. Chairman, but that was another nod to Chairman Coe. Thank you guys both so much. John Freeman, thank you for always having your expertise in the room. It's been fantastic. And Gary, fantastic words of wisdom you've provided over the years, and I truly value your friendship as well. So thank you guys all so much, and look forward to hearing from you guys as you guys move on as well.
Thank you, Representative Brown. Go ahead, Gary Pieperinen.
Yeah, brothers and sisters of the legislature, I want you to know it's been my privilege these last 8 years to associate with you. How much I would like to be in your presence and shake your hand and embrace you and express my love to each one of you. You don't hear the word love very often on the floor of the House. But the other day I put our picture that we had taken in the Territorial House on Family Search. And I was able to go through each photo, zoom in on it as my eyes are getting challenged. And I could name each one of you. I don't think there's anybody here on my screen that I have not looked in the eye and expressed my appreciation for you. Serving in the legislature amongst you guys has been one of the greatest experiences of my life, and I will continue to carry that in my heart. Again, thank you for letting me serve with you.
Thank you, Gary. You did a great job. I appreciate working with you.
Thank you.
Representative Freeman, you're the last one to say a word.
Thank you, Mr. Chairman. And that is a term of endearment for me to you. I very appreciate your leadership, your friendship, and the collaborative nature that we've developed over the 8 years that we've shared in the legislature. I want to thank everybody for their service, and you know, I'm looking at all the people that are on my screen, and you know, I have special relationships with all of you. And I'm sorry if I don't mention your name specifically. Hank Coe's put up with me for 16 years, 10 years as a legislator, and 6 years as a member of the Board of Trustees at Western. And you know, I've got to know him over the years and very much appreciate him. You know, I was a school teacher for 23 years, 33 years, excuse me. And principals and I didn't get along, and I had a hard time developing friendships with them. And then I find the principal that I wanted, and he's retired from the principalship with Jerry Paxton, and would have loved to work for you and loved working with you. I remember Albert Summers getting elected, and about 9:30 one night, he gives me a call and says, "What do you think about accountability?" And instant friendship, instant camaraderie to go forward. You know, I'm looking at the person I sat next to most of the time, and that's Representative Flittner. And I just love the side conversations that we had and going forward. And I can't leave without thanking my cohort in crime, Representative Conley, who I also conspired with, as well as Senator Rothfuss. I kind of leave Representative Pieperinen with the last thank you. Both Gary and I were almost killed in the legislature because we worked so hard. We disregarded our healths, and then we found ourselves in ICU units for an extended period of time. And I think that talks about what you give to the legislature. When you're in those chairs, you're in that building, you're working for kids in the education committee, and you're working for the for the state. And I am very thankful that I had that opportunity to go forward. And I'm not doing very well with retirement, finding stuff for me to do. So if anybody has an idea of my next step, give me a call. But I really appreciate each and every one of you. You know, Representative Obermiller, Representative Simpson, Representative Brown, you're all special to me as well. Thank you very much for this time, Chairman Northrup.
Good job. Thanks, John. All righty. Well, I don't have anything words of wisdom say that haven't been said. You're great people. I love you. Take care of yourselves. And I wish I had one more jab for Brown, but I really don't. So get out of the basement, go see life, get into daylight. And with that, I'll tell you, let's adjourn this meeting and go eat.